Wellbeing Board, held today, Thursday the 29th of June. This meeting is held in public and therefore I must remind everybody that it is both recorded and broadcast. So as long as you're aware of that. Can I ask that when anybody speaks, they remind us who they are, particularly presenters as such. But we'll start off with membership of the board, and I'll start and we'll head that way around the room. So I'm Viv Kendrick, I'm the Chair of the Health and Wellbeing Board and Cabinet Member for Children and Young People.
Hi, I'm Alex Chaplin, Strategy and Policy Officer for Adult Social Care.
I'll get it right this time. Rachel Spencer-Henshaw, Director of Public Health for Kirklees.
Hello, Lucy Wearmouth, Head of Improving Population Health, Kirklees.
Owen Richardson, Data and Insight Enablement Lead for Public Health, Kirklees.
Hi everyone, Rebecca Elliott, Public Health Manager, Kirklees Council.
James Krieger, I'm the CEO of Kirklees Care Association, representing independent sector providers of social care.
Hi everyone, I'm Alistair Brown, I'm representing Third Sector Leader, Kirklees.
I'm Jim Griffiths, I'm the District Commander for the Police in Kirklees.
I'm Mary Wishart, I'm Director of Strategy and Partnerships at Legcala and I'm representing for Karen Jackson today.
I'm Musrat Khan, I'm the Cabinet Member for Health and Adult Social Care with Kirklees.
Hello, Vanessa Taylor, Director of Practice and Care Partnerships at the University of Huddersfield.
Hi, Christine Fox, Director of Customer and Community Services at Connect Housing.
Hi, I'm Carol McKenna. I'm the Place Lead for the Kirklees Health and Care Partnership, part of the West Yorkshire Integrated Care Board.
Hi, I'm Vicky Pickles. I'm Director of Corporate Affairs at Calderdale and Huddersfield Foundation Trust, deputising for Catherine Riley.
Hi, I'm Izzy Worzick. I'm Associate Director for Provider Collaboratives at Swift and I'm deputising for Sean Rayner.
Mark Thompson, Councillor within Kirklees.
I don't really know what to do about the people in the cheap seats at the back without microphones. But having said that, those of you that are coming up to do presentations, if you would introduce yourselves at that time. But welcome everybody. Thank you for that. Jenny, if we could have apologies, please.
Stacey Appleyard, Nicola Goodberry, Sean Rayner, Catherine Riley and Dr Nick Hardiker.
Thank you for that. I have to say Tom Brailsford is due to join us, but he's tied up with another meeting, but he will be joining us as soon as he can. And Rachel Spencer-Henshaw, who's come to do a presentation for us, has to leave early because she's got to rush to another meeting. All busy people in this room. Thank you very much. So if we could move on to item 2, please. Minutes of the previous meeting held on the 30th of March 2023. I don't know if anybody has any comments or alterations, amendments that they want to raise.
We do have one correction. We do have one correction, Chair. The minutes need to reflect that Sean Rayner was actually in attendance at the meeting on the 30th of March.
Thank you. We will amend that. I think all the action points, when I look through, are covered, either being dealt with at this meeting or future meetings. Are we happy to accept these as a true record? Yes? Thank you very much. So item 3, interest. Board members are asked if there are any disclosable pecuniary interests that they complete the form that's in the pack, or come and get one from Jenny and leave it with Jenny as such. This meeting is held in public, so the public can flood in at any moment now. They may well be watching online, you don't know. Deputations and petitions. Have we any deputations or petitions?
None received, Chair.
Thank you. Public question time. Have we any public questions?
Again, none received.
Thank you. So that leads us quickly on then to item 7, Director of Public Health Annual Report. And you're kicking this off, Rachel. Thank you. Over to you.
Thank you so much, Chair. So we've got a presentation that I'm going to take you through. So I've got my clicker here.
I'll just give us a second before we get it on the screen. So just to kind of wait until the presentation's up, I'll just say a few things. So just to say, obviously it's part of the responsibility of the Director of Public Health to publish an annual report each year, and that's essentially based on the intelligence that we get from the Joint Strategic Assessment and obviously part of the Health and Wellbeing Strategy, and it's whatever's pertinent to the district and worth highlighting in terms of that. So this year we've done a report on poverty, and I say we because it's very easy sometimes to come and present this as my report when clearly my colleagues sat beside me, as well as a number of others of you, have done a lot of work for this, and clearly it wouldn't be the product it is without the engagement that we've got. So the Director of Public Health annual report this year is about poverty, and we've done it in a slightly different way this year, but I wanted to just take you through some of the key points. So hopefully you can see that. I'm sorry about the... It's very difficult, isn't it, when you're doing a presentation to know what the text's going to look like, but hopefully you'll be able to see the details. What we know about poverty is it has a significant impact on a broad range of health outcomes. It's very difficult actually to find a health outcome that isn't impacted on by being in poverty. So that we know that that will have a significant impact on anyone that is experiencing it. We know that current cost of living crisis is having a massive impact on people who were either already in persistent poverty, or it's pushed some people who weren't into poverty. So clearly we are in a crisis at the moment. One of the real big things for us is that we cannot understand and address these issues unless we involve the people who are experts, as in those people with a lived experience of poverty. If we don't start thinking about people who are experiencing it and working alongside them, what we risk is to try and create interventions or intervene in a way that isn't going to make a difference to those experiencing poverty. So, as I've said there, they should be front and centre in influencing change. And what we've tried to do with this report is capture some lived experience to really get a sense of what it's like to be in poverty in Kirklees. And then finally, I think the poverty as a systems issue point is something that the Health and Wellbeing Board is going to be particularly relevant for, because we can't tackle this alone, so it's how we look at that together. So, we gathered some insight during the winter of 22-23, and obviously at that point, and I appreciate things have changed so rapidly, but inflation was above 10%. We had huge rises in costs of essentials, including food, utilities, rent and mortgages. We clearly know now that we're in a different phase of this, but clearly it's not getting better for people, and although there's been some reduction in things like fuel at the pumps, that's not necessarily the case in terms of food inflation, and obviously the situation with mortgages and rents is getting worse and worse. So clearly the findings, although they were done over the winter period, are very much relevant going forward. So Citizens Advice reported unprecedentedly requests for support, particularly from those who had reached crisis point. So what we're finding is, even though people were going to Citizen Advice before this period, people are reaching crisis quicker. There is more crisis, people in crisis, so it's not like we're in a position where things are getting less, and actually the demand is becoming more and more. We've had reports from Health Watch colleagues around people avoiding NHS appointments due to the cost of travel and the cost of actually even phone calls in some cases, which is obviously challenging. And then few people taking up prescriptions and potentially not visiting things like the dentist. So clearly what that does is it creates a hell of a lot of things that could have been mitigated in primary care through use of prescriptions or access to dentistry. And that might ultimately impact on the system in terms of people presenting at A&E or in other circumstances. And we've had twice as many referrals into food banks through our welfare and exchequer team, and clearly that's only the stuff we know about. It's not the stuff that will happen outside of our system. So demand is high for all of those things. So I know that lived experience is an interesting, challenging word for people, and it's become a bit of a buzzword in terms of kind of how you describe getting the views of people. So however you want to articulate that, we've used the term lived experience, but I know it's not for everyone. But again, it's fundamentally about actually having a conversation with people who are living and breathing this, so that we can get a sense of what it is like for them to be in poverty. And I just want to thank the 12 people that came across to us and were as open and as brutal as you could possibly be in terms of what they were experiencing. And we couldn't have written the report without them, because they were absolutely honest with how it was affecting their day-to-day life being in poverty. So thank you to them. They came from a range of different backgrounds, and they were living in many different situations and across the whole of the Kirklees district. So we got a real kind of broad range of individuals, which was brilliant. Quite a lot of them had some support via our local area coordination teams, that I know is a partnership agenda that we run in the council alongside our health colleagues, equally social prescribing link workers. And actually what we found was, because we had those relationships with those individuals, they were able to help us provide that emotional support, because clearly sharing having to experience poverty and then having to share it as well is a challenge. So we really wanted to wrap the right support around the individuals to make sure that they were supported during this process. So the main themes that came out of this report was that people were really struggling around household bills and general finances. Again, that won't be a surprise given what we've seen reported in the press. Skipping meals, buying food that are going out of date, trying to kind of make sure they were buying food that was as reduced as possible. And sometimes that was on the basis of hoping that it was going to be okay, rather than, there was probably a level of risk there that wasn't previously in terms of making sure that that food was on the table, as opposed to risking, in some cases, it might have gone off. So that was always a challenge. There was a lot of hope, and I think sometimes you tend to ignore the positives when you're thinking about the negatives, but there was a lot of hope that things were going to get better. And it's interesting for me to wonder how long that will carry on for, because I think that we had that a lot during COVID, didn't we, where everyone kind of banded together, and then the longer it went on, people started to get a little bit frayed. So we have to try and keep that in mind, that the hope will only last to a certain period of time. Mental health issues were coming as a result of living in poverty, and obviously people were describing that in different ways. Sometimes it was about anxiety, sometimes it was about depression, but very much a case of mental health being a really important issue. Travel costs were highlighted as a barrier to access to services, so it wasn't necessarily that the services weren't available for people and that they weren't necessarily not open and accessible in terms of the times they were available. It was actually the cost of getting to the services that was a challenge. Issues with housing was raised, particularly in relation with relationships with landlords in some cases, the ability to afford rent and the fact that that was often being increased, and damp and mould. And obviously there's been a number of really tragic cases around the health impacts of damp and mould. So that's really shone a light on that in terms of the quality of housing in the district. How you protect your family in some cases, so the individuals, and not all of them necessarily had particularly the same family circumstances, but there was a very strong will to protect the children in those families from the impact of poverty. So again, speaking personally, I think it's quite hard to experience something that's stressing you out and then having to be a different person in front of your kids. It adds an extra dynamic. So I think the knock-on effect for that was potentially a level of social isolation, because for family members, when they were with others and when they were with their children, they were showcasing that everything was okay, and that puts a huge pressure on people, and it makes it difficult then to connect to people and to ask for support. But clearly there was a lot of support from others if they were in that similar and those networks. So there's strong communities in Kirklees, as I know we're all aware of, and for some people that was the difference between surviving and not surviving in terms of the crisis that we're in. So I think it's really important that we remember the role of the voluntary community sector in being pivotal in supporting people in these crisis situations. And then finally, kind of work opportunities and making sure the right work was out there, because clearly people, there is some work opportunity, but there isn't necessarily the right type and, I suppose, family-friendly element of work. So there's a few recommendations around that, but they were the main themes. We've got a video that I am assured Matthew will be able to play for me, which just does a bit of a summary and probably articulates some of that better than I have. Are you all right to play the video, Matthew?
In Kirklees, like the rest of the UK, we have experienced a global pandemic followed by energy price rises and inflation. We wanted to know how people were coping and what could be done differently. So we interviewed 12 residents over the winter of 2022 to 23. Their stories were honest, challenging and inspiring. People were struggling but proud, and despite their own difficult situations, concerned for others. These are their stories. Bills and heating. About half had borrowed money in the previous month, and many were behind on energy bills, with the worry their homes would get damp and mouldy.
When I look at the bank and there's a fiver in it, and there's 2 weeks left to the end of the month, and I'm like, right, well, I need to try and get someone to put the food on the table, to be able to put the heating on, and whatever else.
Housing. Those in private rented accommodation were dealing with sudden rent increases. Several people were living in overcrowded conditions. Some were struggling to get basic repairs carried out.
I don't feel clean when I get out of the shower. I hate looking at it. I don't want anyone to come over and use the shower or the toilet.
Food. Many were skipping meals or choosing damaged goods, and those with health conditions worried about eating low-quality processed food.
Fruit is not important. That's when electricity and gas is important.
Family. Those with children shielded them as best they could from harsh realities, but were going without just to afford the essentials.
The kids, we can't afford to send them to any clubs or anything. You know, any extracurricular activities. It's like the school trips. It's like £18 for a trip. It's ridiculous. And my son, bless him, he said, "Oh, Mummy, I'll use my money. I don't want to miss out," because all his friends are going.
Mental health. The strain of constant calculation and the absence of fun was wearing, with people's mental health impacted by living such restricted lives.
I started feeling gloomy and doomy because of it, because I wasn't able just to switch on the light and have a cup of coffee and relax. You know, I don't really have a quality of life, and I felt suicidal.
Isolation. Residents who lived alone felt isolated and unable to socialise. Some were forced to use candlelight at night time.
I'm not in all day, so when I get home tonight, if I'm cold, I think I can put the heating on for a couple of hours because I wasn't there.
Support. People were immensely grateful for the kindness of others, particularly those supported by local area coordinators or community coordinators.
I always turn to the school, even though I don't like taking my problems to the school, but I don't feel like I'll get judged.
Nobody we spoke to expected more than the minimum that would make their lives bearable. Everyone we spoke to was doing their best to survive in circumstances out of their control. This honesty was vital, and it was a privilege to hear stories from across Kirklees. Poverty matters. It is now our responsibility to drive forward changes at a local level. Many people we spoke to were suffering in silence, and pride or the stigma of being recognised prevented some from accessing help. Our recommendations focus on what we can do at a local level to instigate change. Our recommendations are relevant for individuals and organisations across the Kirklees system. They include recommendations which are based on feedback from Kirklees residents, for the wider health and care system, for organisations working with Kirklees residents, for individuals or community groups who want to help, available for residents living in poverty. You can see the full report and recommendations on our website.
Okay, thank you. Clearly, as I said, did a much better job of articulating some of those key themes, but hopefully that resonated in terms of the themes that have come out of that. So if I just click on to the next slide. So as it said in the video, we've got a web page where you can find the full report, and it should be quite reasonably easy to navigate it. We've got in there, we've got the why poverty matters, so it gives you a bit more on the statistics around what poverty does in terms of the data, etc. It's got the national context, but clearly, given the national context changes quite quickly, it will be as up to date as it can be. We've got our local context where we've brought in some of our local data, local intelligence in terms of what's happening around poverty. We've got the case studies that we've articulated in terms of some of the stuff you've seen on there. And what you'll find is that they're almost documented as a bit of a day in the life, so you can almost see what somebody's day-to-day kind of existence is and how the poverty is manifesting itself in some of their choices and actions. So hopefully that will be useful to have a look at as well. We've got in there some case studies from our partners, which I'll just come on to when we go through the next slide, and then some support and recommendations. So please, I'd encourage you to have a look at the website and obviously use it with your organisations going forward. Just to say, obviously, as part of creating this, we did talk to a number of community organisations, and we particularly talked to our community anchors, who were so fundamental alongside TSL colleagues and others during the pandemic. And we've got some case studies from all of those about what they've been experiencing as providing services, which gives you a nice perspective from both the individuals themselves and the organisations that are out there on the front line supporting them. So again, the way we've got these recommendations together is based on all the intelligence that's come from both the individuals and those organisations to get hopefully a set of things that we can take forward as a Kirklees system. So in terms of what we were told that would make life easier, how we can support people with the cost of living crisis, and that's very much about targeted support to mitigate the increases in costs of food, rent and utilities. So I think that's very practical, and I know that there is quite a significant number of organisations doing this already, but it's how we can make that as targeted as possible to make sure we're getting to the right people. Professionals and decision makers need to gain a deeper understanding of the reality of living in poverty, and I think this is something that we've talked a lot about as a health and wellbeing board, and it's something that I know I bang on about all the time, which is sometimes we have a tendency to identify people by either a health condition or something that they're experiencing as opposed to them as an individual. So it's how we can be professionally curious and understand what it genuinely is like. And I think for me, one of the real important part of being a system as we are is saying, just because you happen to be representing the health service and you're a district nurse, for example, it's how you can understand the experience of somebody's housing that they're in and the impact of some of that, and look at things in a more holistic way. How we can think about cost issues for travelling, for access to services. So given that was such a key thing, how can we make sure that the cost of getting to services doesn't prohibit people from actually using them when we know that actually that's an important intervention for them? A lot of people preferred face-to-face support from a consistent and trusted person, and I appreciate that's not everybody, but if we can start to be more targeted about our interventions so that we've got the face-to-face protected for people who are in those positions, that might help us to be able to ensure that we've got the right conversations happening in the right place. I've talked a little bit about flexible working opportunities, and obviously childcare, affordable childcare is a big thing in terms of families trying to juggle the choices between working and not working. So how we can make sure people understand the support that's available, because there's obviously quite a lot of free childcare available now, and it's making sure people understand it and can be helped to, or if necessary, to get access to that support. Costs around things like DBS checks, it seems quite simple, but actually if a job requires a DBS check and the onus is on the individual to pay for that, that's a real challenge in terms of will that put somebody off, and can we do more to support people so that we can get them into employment? How can we use community spaces to support linking up that doesn't cost money? Because I know it's easy sometimes to say we'll all go and meet in a coffee shop, and that's fine in some cases, but if that cost prohibits people from getting together, then clearly we need to do more about some of our many community buildings across Kirklees. And I've mentioned housing and how important having a secure tenancy is, and how actually that sort of insecurity about whether you're going to have a roof over your head often outweighs any kind of consideration in terms of health and other issues. So it really is about trying to address what's the most important thing for an individual at that point in order to then better improve their health outcomes. How am I doing for time, Chair? I'm okay, right. I've only got a couple more slides. So there's a few examples of recommendations there. There's some national policy suggestions, which I appreciate, you know, in one sense, it's how we take those forward. And I think that for me, putting health equity and well-being at the heart of any kind of planning is really important, and understanding the impact that we're going to have on health and well-being in terms of policy decisions is something, certainly as a Director of Public Health, I would always champion. For the health and care system specifically, because obviously as this board, that's something that we're particularly key in. I think it's how we kind of have that commitment for tackling poverty at our level, because it is such an important thing. And even though quite a lot of the wider determinants of health are more challenging for a health and care system, it shouldn't preclude us wanting to take and see action around them. How we can look at inclusive and sustainable economic change. So that's about our links with the economy and the economic strategy for Kirklees going forward. Again, using these views to help to co-design and develop better communications and better services, and how we can just really champion that lived experience so that it's used in a way that helps us to improve things across all our work. So I'm gonna probably, we've got a couple more slides, haven't we? So there's a few examples for organisations working in Kirklees, which is very much based on the case studies. So how can we make sure that people understand and take up the full range of statutory financial assistance? Because it's not so much that, it's often that we find that people don't know what they're entitled to, and it's how we make sure people get access to what they're entitled to. That's absolutely key. How do we make sure debt collection processes are done in a way that's going to be as sensitive as possible, because you can't find money if it doesn't exist. So agencies such as Step Change, which is really good in terms of a charity to support people with understanding where they can get support around debt, is really important. How we involve the voluntary community sector, I know we're doing that through our VCS investment strategy, but there's more to do in terms of making sure that whatever we develop as local policies have those views writ large within it. And clearly, from my perspective, I'd always count local councillors in that, because local elected members are often the voices and the ears and eyes on the ground, and they can be hugely influential in terms of what's actually going on in their communities. How we can embed the rising cost of living costs into clinical pathways. So thinking about, it's not just about when someone is there at a service, it's how we get them to the service, and how we understand if they've got repeated need to come back to outpatients, for example, how we manage some of that, and we consider that as part of setting up our clinical pathways. And then poverty-aware practice, which I know, again, is sort of it feels a bit jargony, but actually there's some really good training and resources available that we can signpost to get poverty-aware practice within your workforces. So for individuals out there who want help, we've obviously got some guidance for frontline staff, which I've alluded to. TSL, obviously Alistair's here to represent them. TSL can help around volunteering opportunities for individuals, as well as support available for people filling in documentation, etc. And just to listen to people, so that actually we are confident that what we're setting up and creating does meet the needs of our population. Last slide, promise. So next steps. So, you know, obviously, hopefully the presentation, a little bit more so than me, but articulates the fact that poverty matters, and we cannot just do one thing and it makes it go away. That's not how it works. So how do we all look at the various influences we have as a system to be able to improve things? I'd like to ask you as a board to disseminate the report and use it where you think it's going to best have an impact. And as I always offer every year, if you want me to come and talk to your organisation about specifically what we could do more, I'm always happy to do that. And clearly have a think about reading the website, have a look at the video again, sharing some of that. And I guess just opening it up to the board chair about where we could use this report going forward. Thank you.
Thank you very much for that, Rachel. Quite a lot of things to think about and some very pertinent things. Could I ask, will the slide pack be shared to all the board members, please? Well, everybody attending, actually, I think would be interested. I don't know if people have any comments or questions before I...
Thank you, Chair. I think one of the challenges that we've got, like any borough, is the collating of the information of the people that most need the help. And there are so many touch points that these people go through on a daily basis. It might be a housing officer, it might be a social worker, it might be a doctor, dentist. So that there's so many places where, or people that they see and come into contact with on a daily basis. And surely as a council, if we had a single repository of information that the different people could put that information in to assist these people, it would be better for the individuals and the council to be able to help than it would depending on these individuals reporting it or hoping that it gets reported. I just wondered if there was any plans or aspirations to be able to do this across the board through the borough, that we could best help the people most in need. Thank you, Chair.
Interesting question. You want to have a go at it, Rachel?
Yeah, I mean, I think it's a very valid point in terms of how we can understand who are most in need and how you get that better data collection. I think what we've tried to do is set up a Tackling Poverty Partnership, which has multiple stakeholders on there, from particularly voluntary community sector, but also different council services as well, to try and be able to make sure we're sharing at least an understanding of where some of those pockets are. Where it gets slightly trickier is when you start to get into individuals because of data protection requirements. So it makes it a little bit more challenging in terms of sharing information. Interestingly, during COVID, we shared information because obviously quite a lot of data protection rules were put to one side in order to really get to grips with where some of the, for example, our cases of COVID were and our uptake of vaccination. And I think we've lost some of the ability to do that perhaps as well as we can do. But that doesn't mean to say we can't look at what's called pseudonymised data, which is where we understand that there's perhaps a particular postcode in which we know there are people that need that extra support. But there are very much a development of sharing of data between some of the main health and social care providers to make sure that we are actually looking at somebody's journey across the system, not just within the health service. But I think it's an ongoing journey because there isn't really a single answer to that across the system as yet, but it's also always something that we would aspire to do. So I agree with you, and we're definitely trying. I think it's just how we get through some of the challenges around data protection, and in some cases it's also the systems, the IT systems, and how it's recorded, and whether or not the quality of the data that's collected actually best meets our needs, because often it will be the how somebody's inputted into it. So it is an ongoing challenge, but definitely one that needs looking at.
Thank you. Anybody else want to?
Thank you, Rachel. I was actually really moved by the presentation, and it does bring it home a little bit, doesn't it? Because you know, we hear it all the time, but actually to see the reality of it. And we're hearing from our providers around people who are making decisions about whether to, not so much at the moment, obviously, but in the winter, whether to, you know, to put in extra jumpers on, whether they can afford to put the heating on or eat. And when you see people are making those decisions, I've come across people who are leaving our sector because they just can't cope with the fact that they're having to leave people in incredibly vulnerable situations, and it's just impacting on them. But nobody will be surprised when I say what I'm about to say, which is that we've got, you know, we talked about people who are in employment entering into poverty. We're seeing that more and more, and I suppose the plea for me is that we need to ensure that our people who are working in social care, in the independent sector, in the VCSE sector in particular, I think, who are looking after our most vulnerable are rewarded appropriately and paid a fair and equitable rate of pay. And I think we've got an opportunity to, you know, it pains me that we've got staff who are going to food banks because we can't afford to pay them enough. We've got something wrong, haven't we? We need to. So it's just a comment, but I'm sure nobody in this room will be surprised that I would say that. But it really is something we need to address. But thank you, it was really good presentation. Thank you.
Thank you. I'm just looking, anybody else want to? Alistair?
Yeah, thank you, Chair. Yeah, and thanks very much, Rachel. I think it was really useful, a presentation, and definitely we'll try and get you to third sector leaders, because I think you said pivotal role, and absolutely I think they have access to local people and their stories and their lived experiences sometimes more easily than the statutory agencies do, and absolutely what Jim says, I think it's about building on that and trying to do that as well. This position is only going to get worse, unfortunately, in the short term, in the housing crisis and so on, and we really need to move beyond the recommendations even that you've got, I think, to really get some collective information together and some action together. I think that's so important. So I suppose I'd like to really take it on that stage. It'd be great to hear you coming back, you know, in 6 months' time, in a year's time, because the issue is still going to be there, and what progress have we made and how can we move that forward. We're very lucky in the district to have so many VCSE organisations which are doing an incredible job. Uniform Exchange, the Mission, the food banks, you know, all under huge pressure themselves. So how can we support them to support our communities? It would be really great to hear back in the future, but thank you for that.
Thank you for that, Alice. I think you're absolutely right. Anybody else?
Thanks, Rachel. I think from it's given me some real food for thought from a hospital perspective, particularly that bit about calling people back for multiple outpatient appointments, or for instance, if you're coming in for surgery, you come in for a pre-assessment and then another assessment and then the surgery and then a follow-up. And it's really thought-provoking to think of the wider consequences of that, not just the general inconvenience. I know we've started to think about something that you didn't mention, but potential costs of childcare when we call people in, particularly for diagnostics and screening services and things. But it's been a really helpful prompt to us to take that back in and consider how we can help to reduce those costs and reduce the multiple interactions that we're having.
That's excellent to hear. Thank you very much. Anyone else? Before I indulge myself. I suppose one of the things that struck me under the themes, the bit about travel and the cost of travel, but I suppose there's a bit of a dichotomy going on, because as an organisation, we as a council, but other colleagues with other services, highly rely on IT and people being able to access information and help that way. The people in the video, if you like, I suspect did not have access to IT. And actually, it's a sort of double bang for them, isn't it? And I think we have to... It was interesting when they said they prefer to see face-to-face contact, and I can understand why, but I do think we shouldn't be always reliant, you can access it online, you can do this, you can book that, you can get help, and information isn't always going to be the answer for some of the most vulnerable people. So that's one thing. The work opportunities bit, I absolutely get where it has to be, you know, childcare is an issue. But the issue for me as an ex-welfare rights worker is you can be going into a job that looks absolutely great, but you have to understand the impact on the benefits that you receive. And I've known people go into jobs without getting that support and finding they're far worse off than they were sitting on benefits. I'm not advocating anybody sitting on benefits, but it's how we make sure that people are helped to judge and know clearly what the financial impact of taking a particular job is. And I have a third one, housing. And there was absolutely right about the issues with private rented and housing and so on. But actually, you know, the cost of living as it is now is impacting on interest rates. And there are people with mortgages who are wondering if they're still going to be living in their house within the next 2, 3, 4 months. and they shouldn't be forgotten. And they're in a dire situation, almost worse, because you can end up having to lose your home. It's sold because you haven't been able to pay the mortgage, and it doesn't achieve the cost of the debt that you owe, so you still have this debt hanging over you. And people think, oh, well, they're on benefit, they'll get help with mortgage. You don't get any help with interest for 6 months. So you're already built a debt before you get going. So the comment about, you know, the re-looking at things like universal credit is absolutely right. The benefits at the moment lead people into very dire situations. And I've one last comment, which isn't particularly subject related, in terms of really interested in listening to those people, and I'm really glad you had folks, particularly the voluntary sector, helping access them. But there are an awful lot of people, and I do come across them sometimes as a ward councillor, I'm sure Mark does, who are never going to be in touch with a voluntary sector and community organisation, who are isolated and sat at home, and how we hear their voice and their experience is the challenge, I think, for all of us. So there I've really indulged myself a fair bit then, but anybody else with any comment or question? No? So I think particularly we're asked to disseminate this, look at it online, share the video, and I think that's a responsibility for everybody in this room, please, if you would undertake to do that. And we are asked to disseminate the information on page 14 as a reminder to you there. And any comments or anything that you would like to feed in, I think, would it be you as the contact, Rachel?
Yes, absolutely.
Okay. Can I thank you very much for an excellent presentation? Thank you.
Could I just thank, again, my colleagues for doing the report, because I do, and everyone involved in it has just made it, and also Councillor Khan as the portfolio holder has really championed this, so thank you.
Absolutely so. And we know you're just a figurehead, and the real people doing the work are sat over there and there. But thank you, all of you. So, thank you for that. Can we move, therefore, then on to item 8, please? The Kirklees Health and Wellbeing Strategy Update.
Hi, everyone. So I'm going to kick us off with the cause updates. Obviously, we do break them down by a priority area, and I do apologise for how boring this slide is, but it's just to sum up, because there was a bit of feedback at the March board about our approach to these updates. So it's just a summary, really, to reconfirm with the board, and if we have any feedback following that, then we can take that on and put in place a different approach to these updates. But just to reconfirm with the board that when we signed off the strategy in September, that it was asked from the board that we have an in-date update on one priority, and we have that rotating, and then we have some summary updates from the other two priorities. So, for example, today the main update is going to be from our colleagues who are covering off healthy places, and then we will have a quick update or a summary update which will have a RAG rating attached to it, covering off connected care and mental wellbeing, and then the rotation goes around again. We can also include, where appropriate, general cause updates as well, but just a bit more detail. So our main updates, as you'll see today, will be a much wider update. We're covering off about 15-20 minutes. We'll have a general overview of the work under priority, optional areas to highlight, successes, challenges and requests for support. And then our two summary updates, we do have a bit of a, as I say, template, I use that word loosely, for the summary updates, but it's just for people to highlight, again, successes, challenges, a very brief overview, and again, requests for support from the board. So, yeah, that's me, really, on the cause approach, just to say this is what the board agreed to in September. I think moving forward, if we see how these updates work for the board, and if we do need to rejig them again, then we will. But I think if we just allow at least sort of one rotation, and then we see where we are, probably in September, at the September board. And I hope that's okay. And now I'm going to pass to Becky Elliott.
Thank you, Alex. Is this on? Is this working? Yeah. So hi everyone, as I said, my name is Rebecca, I'm a Public Health Manager at Kirklees Council, and I'm just here to give an update on behalf of those colleagues working on the mental health wellbeing programme. So we actually will be coming back in July to do a deep dive on mental wellbeing. So part of the ask today was for colleagues and board members to have a look at the highlight report which has been shared with the papers, which I appreciate isn't on the template, Alex, but we'll strive to do that for next time. But if colleagues and board members want to have a look through the highlight report which has been submitted, this is the highlight report that we actually share with the Kirklees Mental Health Alliance, so I think we were just trying to avoid duplication of reports essentially. But if people want to have a look at that and have a think, if there's anything particular that they would like us to focus on for the deep dive in July, then please let me know and I will cascade that back to the rest of the colleagues that work on the mental wellbeing agenda. We are short on time today, so obviously I won't be able to cover much. But I just wanted to share some of the recent successes that we've had around the mental wellbeing programme. So we last came to do a deep dive in January, I believe it was. So you may have had, you may recall from January that we had an update around the primary care mental health transformation piece of work. We have a new serious mental illness, physical health and wellness team across Kirklees as well here that are inviting people who are on the serious mental illness register in for a physical health check with their GP. And in some primary care networks, that's really having a significant impact already. So that might be an area that colleagues want to hear more about in July. In terms of suicide prevention, we are in the middle of a really insightful and successful suicide bereavement quilt roadshow that's taking place across lots of different communities in Kirklees, and will finish on the 6th of July. If anybody hasn't had a chance to see those quilts yet, please get in touch and we can share where they are taking place. But it's proved really fruitful and insightful to hear from our communities about having conversations around suicide in our district and really tackling that stigma. So that's been really, really positive. And one of our VCSE organisations, Community Links, has a project called Men's Talk, which are providing a mental health theatrical production around lived experience of mental health. And that's now receiving national recognition. So again, just really important to kind of show that we are paving the way for some new innovative ways of talking about mental health in Kirklees, which is really positive. In terms of milestones coming up, we are reviewing our mental health community options contract, and just linking in with the previous presentation around the DPH report on poverty. Poverty is both a cause and consequence of mental health. So with any commissioning that we're about to embark upon, I think it's about how we really try and think about linking poverty and looking at the poverty lens throughout any mental health work that we're doing. We'll be taking the I statements of the strategy to the Mental Health Alliance in August to try and really get some traction on how we tangibly take forward some of the things within the strategy and ask other partners how they're going to actually take some of these suggestions forward. And then the final thing I would say is just in terms of lived experience, which again we've already spoken about this morning, really important that we are working with people across the district with experience of mental health to inform not only what we do but how we do it. And so the service user arm of the Mental Health Alliance is well underway now, and just wanted to share that that's happening, because I think that's a really positive step forward, that's vital to the work that we do around mental health. So that's it for today really, but just if colleagues want to get back to me on the mental health programme is so broad, and I appreciate it's hard to kind of keep on top of everything, but if there's a particular area that you would like us to focus on the deep dive, then that would be really helpful. Thank you.
Thank you very much. You're going to lead us further with this.
And next we've got the Connected Care Summary update, and I think Rachel Wilson.
Just play musical chairs while people...
Hi everybody, my name is Rachel Wilson and I am Senior Planning and Strategy Manager for the Kirklees ICB, which is part of the Health and Care Partnership. So just a really brief overview of the progress we've made around the Connected Care and Support priority. So I think one of the key things that we've achieved in the, since the last update was the health and care plan development. So that's now being signed off through the ICB board. It was signed off in May, and we've got quite a substantial agenda item on that coming up. Couple of other things that we've done that are sort of more programme based. So we've had a system-wide event focusing on discharge pathways, thinking about how we move towards advocating a home first approach on discharge, and that's with partners across the system. And we've had ongoing discussions through the Health Inclusion Network, again focusing on health inequalities and the impact of poverty, thinking about how we collectively come together and agree some actions around reducing inequalities across the system. So how can we collectively use the power that we've got as partners to try and make some impact and some changes around inequalities. And then we've been doing some ongoing work around our community services contract, and the review phase of that is now sort of being completed, and we're into the design phase, which is sort of how the future service specifications will be built and what the future service will look like. In terms of upcoming milestones, so we've got ongoing work around some of the implementation of the health and care plan, which is through the strategic themes, which are the WELLs, which again you'll hear more about at the next agenda item. We've got more follow-up conversations around discharge and health inclusion, and we are looking at our response to the primary care access recovery plan that was published last month. So we're looking at what the requirements of that are, and we've got a group that's set up to look at how we deliver on some of those priorities going forwards.
Thank you for that. Are you going to take a call?
And now we're going to hand over to the main cause update, which is Healthy Places.
Could you share the slides, Matthew? Thank you. Hello. Right, good afternoon, I'm Lucy, Head of Improving Population Health, and the observant people will notice that this is not Avina. Julie, do you want to introduce yourself?
Yeah, hi everybody, I'm Julie McDowell from the Democracy and Place-Based Working Service. I work with VINA.
So Julie's been asked in last minute, so thank you very much, Julie. So we're going to talk to you today about the Healthy Places priority as part of the cause. So we're going to talk you through, remind us all about the kind of detail that's contained within that priority, and talk you through some of the successes and progress that we've made across the system in recent months, and then obviously take questions from yourselves around progress and next steps. I think the thing to that we want to kind of highlight is that me and Julie are a bit jack of all trades, master of none. So we are here representing the Healthy Places priority, but we have spoken to a number of colleagues from across the system, from planning, from environmental health, parks and open spaces. So there might be questions that come today that we can't answer, and we'll have to kind of take on to colleagues, but we'll do our best. Okay, so just a reminder really of where that Healthy Places priority sits. I think Rachel's presentation kind of really nicely kind of segues into the Healthy Places work, because we know the impact that your environment, a person's environment, has on your ability to be kind of physically and mentally healthy. We understand the impact of housing and green space and how safe you feel in your local area. That all has an impact on your ability to kind of lead a healthy life. And I spend a lot of my time kind of working along the wider determinants of health. And we know that there's tons of evidence that kind of connects the wider determinants of health to our health and other outcomes. So this is just another slide which kind of reiterates why place matters. So there's a lot of evidence in Kirklees and nationally as well around the fact that people who are living in more deprived areas will be more likely to live in poor quality housing. They're more likely to report that their housing isn't suitable for their needs. even if you live in a deprived area and even if you live near to green space, you are less likely to access that space. You will probably feel less safe as you're going around the area. And also things like food, so access to food, it'll be harder for you to kind of access healthy, nutritious, affordable food if you live in an area that is deprived, and you are more likely to have many hot food takeaways within your local area as well. So this is just a reminder about the ambition through the cause. So the ambition is the physical and social infrastructure and environment supports people of all ages who live, work or study in Kirklees to maximise their health opportunities and to make the healthy choice the easy choice. And these are the success indicators which are associated with that. A lot of these come from our Current Living in Kirklees survey. So this is just basically, as you know, how we understand the impact of what we're doing, how we can assess the difference that we're making through the work across the partnership. So it includes things like air quality, overall satisfaction with the local area, use of parks and green spaces, and levels of physical activity for children and for adults as well. So these are the I statements, and what we've tried to do in the presentation today is kind of demonstrate evidence of how we think we are achieving some of these I statements across the system. So this is what people have told us, that they would like safe, accessible local places where they can meet friends and can do activities together. People would like affordable activities they can do with their children that helps them to be physically and mentally fit. People would like their local areas to be disability friendly, making sure that everybody is included regardless of abilities and needs. And people also want green, natural, outdoor spaces in their local areas that help them to be active and support their well-being.
Is that on? Yeah. Okay. Delivery of the I statements, we've got quite a few examples. Magic in the community meets 3 of the I statements. We've got a video to play. Yeah, Matthew, thank you.
I coordinate the Magic programme across Kirklees. Magic stands for Movement and Games in Chair.
Group of partners come together to deliver our vision, which is more people, more active, more often in Kirklees. Everybody Active Partnership involves us creating a number of programmes and initiatives and to be able to support more people to be active with the activity that they would like to do within the communities that they live. We've commissioned 3 professional rugby league clubs to be able to grow the game of rugby league and the awareness of the Rugby League World Cup within this year. This includes Dewsbury Rams, so today we are at the Dewsbury Rams Stadium and we have 8 schools.
It's World Cup year, the Rugby League World Cup. Dewsbury Rams obviously got the facility and the World Cup side of things, so we thought...
Yeah, it's flipped.
If you go back to the link on the presentation.
To do within the communities that they live.
No. Just love technology. That's it.
So if it starts from halfway?
I coordinate the Magic programme across Kirklees.
No, from the beginning of this one. Just hit play on this and then, yeah.
Magic stands for Movement and Games in Chairs, and it's aimed at people who want to take part in activity but might struggle with the mobility or maybe have a long-term health condition. So it's about finding activity that's suitable for them, that they can come along to take part in every week and also take part in socialising, have a cup of tea, have a cup of coffee, but also have lots of fun.
It's really enjoyable. Everybody joins in and we have a laugh, and you're doing exercises just to help your body keep moving, really, rather than just sitting at home and being lonely. So it's been lovely coming here.
It's a real family, you know, real open to anybody.
Yeah, you feel like it's family.
We meet every Wednesday. The walk has become a social event, and we meet, we talk, we laugh, and we exercise. Shall we go for it and get back on with our walk?
Okay, so yeah, the Everybody Active team in the council is facilitating this through training community partners. Younger people with long-term health conditions are also taking part as well. There are new groups being set up all the time, currently in the Windybank Estate, Dewsbury Hospital and the Mission in Huddersfield. Just click on to the next slide. This is our second example of the Kirklees planning team who are currently supporting Kirkburton Parish Council to develop a neighbourhood development plan in the Kirklees community. And that will contain policies that promote placemaking, good design and access to enhanced facilities. Once it's been completed, that development plan will form part of the Kirklees development plan and will stay in place for the next 10 years. So it gives local people that influence on planning when buildings are being planned and developed. If you look on the Kirklees website, there are a few more that are being developed, they're in progress, and one was recently approved in the Home Valley Parish Council area. To the next example. So this is the Kirklees Playable Spaces team, which in the last 12 months has delivered 17 new play areas across Kirklees. Some of them have still got outstanding works but are in the main open and completed. They're all different shapes, sizes and scope and have been designed in conjunction with local community requirements. They're designed to encourage through-age family play and to encourage full use of the green space, not just the area within the fenced boundary. New surfing has been provided to improve accessibility to the play equipment as well. Examples are Lee Street in Ravensthorpe, Firth Park, Heckmondwike, Warburton Rec, Emley and Jagger Lane Rec in Honley. The council team has worked with schools and partners to set up focus groups to listen to teenage girls in particular about their experiences of parks and find out what they would think would be an ideal green space for them to hang out in the local parks. A number of recommendations have been made and are due to be piloted in the Dewsbury and Ravensthorpe area, and the parks team have been allocated some budget to incorporate this work into some actual actions and physical things.
Sorry. Hello. Okay, so I'm going to talk about the bread and butter thing, which we think is a really good example of working with our local communities to understand their local needs and offer a variety of opportunities. If you don't know about the bread and butter thing, I'll just kind of talk about it really quickly. It's something that we're really proud of in Kirklees. So bread and butter thing is basically it's an affordable food scheme that offers cheap, nutritious, affordable food in really like kind of hyper-local places across Kirklees. So residents can access 3 good bags of food for £8 and anybody can be a member. So there's no kind of stigma attached to it. And like I said, I think we're coming up to the 10th one now in Kirklees. So just some examples of what we've delivered. This is just between March and December 22. So we've doubled in size since here, but 1,603 people shop with the bread and butter thing, and that equated as well to 3,555 volunteer hours. One of the really important things about bread and butter is that it's not just bread and butter coming in, delivering food and then going, so it's run by the local communities themselves. And one of the unexpected consequences of this work was not just about enabling residents to access affordable food, but also helping to connect people within their local area. So if this works, this is Margaret. She volunteers at the Chestnut Centre, and she is just going to talk a bit more about the work which she does.
Okay. Hi, I'm Margaret. I go to St Thomas's Church at Bradley, and a few months ago we were wanting to start a food bank, but we spoke to the Chestnut Centre, which is where I am today, and they told us that they were starting doing something called the bread and butter thing. So in actual fact, we've got about 15 people who come from our church on a Friday to help people pack up the bags of food. We intended only coming once every few weeks, but it's such a great time, and it's just a joy to be here and see people coming and picking up the food. I think the community is really enjoying being able to come along to the Chestnut Centre on a Friday, and I think that it's just helping so many people. We pack 80 bags of vegetables and fruit, 80 bags of cupboard things, and 80 bags of chiller food. We've got about 700 people on the list, so there's still room for a lot more food to be donated. But it's going absolutely great, and we just love being here, and we just love seeing how grateful people are when they get the bags of food.
Brilliant. She's good, isn't she? So I think she highlights the impact of the bread and butter thing. So this is really just kind of reiterating what I've said already. So the local data is telling us that 73% of people felt less alone as a result of volunteering for bread and butter. There's also something about people in the community using the community venues that bread and butter is hosted in that they hadn't used before, and that's really important as well. So it's a really good example of that kind of holistic support within hyperlocal places across Kirklees.
To me. Okay, this example is about safe and active travel. The Walk, Wheel, Ride Hub aims to give people advice and inspiration to travel on foot, bike, e-bike, scooter or wheelchair. It's a virtual hub that will be a one-stop shop for people of all ages and abilities in Kirklees. It's hosted and being developed by EPICS, which stands for Environmental Projects in Kirklees. It's a not-for-profit company. It's also a brand that's been adopted by the newly established Active Travel Hub in Slaffwaite, which serves the Colne Valley. And both those projects are funded by City Connect at Wicker. Okay, some more examples. The data bank Kirklees Council has partnered with the Good Things Foundation, who can supply residents with 6 months of data via a local delivery partner. It assists residents to find employment, manage finances, address loneliness, isolation, and does support health and wellbeing. And we've got online information about that. The next one. So as well as the I statements, there are also the 6 key factors. These are the first 3 of those key factors. I'll just dwell on one of them, shaped by people, which is also one of the council shared outcomes, which was written by local people, and it's their aspirations for how they would like to describe and measure places, improvements in local places. What they want to see there. We've developed, we've borrowed and developed it in Kirklees, developed the use of it in Kirklees, the Place Standard tool, kit and action plan, which is a way of having conversations with local communities about places, and it's about asking them about how they feel about a place and their experiences of living in that place, and it's framed around 14 themes which are about well-being in a place. And to date we have had, I think, over 10,000 of those conversations with people in, or 10,000 people have taken part in a conversation across Kirklees, across 25 activities. I'll just move on to the next one. Okay, these are the next three key factors. I'll just focus on the digital example. There is a loan scheme for Chromebooks. They can be borrowed for 3 months, and they arrive with all the data arrived. Voluntary community sector communities help support that. I think it's up to 8 Chromebooks can be loaned out at any one time, and there are support guides and tutorials available with those. Just go to the next one. So in terms of the next steps, we're asking the board to help promote the statements and sign up to this. There are challenges. We've highlighted the challenges at the moment with the budgets and recruitment. And we do recognise that place-based working can be seen as a challenge because it is across services and partners, but that is also a strength of it as well. There are 3 asks of the board today to comment on and help shape the direction of delivery against the Healthy Places priority. Consider how you can support, that's sort of the first 2, and how we can develop a feedback mechanism to monitor progress and identify gaps in Healthy Places.
Okay. Yeah. Thank you very much. Well, there we are. 3 asks. Anybody got any comments or responses or want to make any queries about what's been presented? No, not at the moment. Go on, Councillor Khan.
I just want to make a comment because there's a lot more going on and detail behind each headline, and just to bring some of the work to life, what it actually means, because you probably saw the word place standard tool and thought, well, how's that related to Healthy Places? And just as an example of, I'm going to use my ward, what we've done, we delivered the place standard tool in a small area where there's lots of elderly people. There was no activity going on, no community kind of facilities or anything, and as a result of that, and working in partnership with the play scheme, we've got more children attending the local play area after the refurbishments, and we're working on improving access to the urban green space that's in the area, because I think one of the presenters said that people in urban areas less likely to access the green space in their own patch, and sometimes that's to do with whether it's accessible or not. But more importantly, we've got a host of community activities led by local people, like luncheons and games and things and walking groups, and that's all a result of cross-partnership working with the social prescribers, Community Plus and Kirklees staff. So you know, it gives us this Healthy Places stuff, gives us the opportunity to focus hyper-local. I mean, we worked on a patch that was around 400 houses, but 65% of them were over 65-year-olds, and that's how it's implemented, really.
Thank you for that. Anybody else? Alistair, thank you.
Yeah, thank you, Chair. Yeah, I think I'm bound to comment on this one, I think, in a lot of ways. And while I thought the presentation was good, it just, I think, as Councillor Khan says, just scratches the surface, I think, of what happens within Kirklees District, but also the strain that some of that system is under as well. Traditional sports clubs are an example, you know, not really mentioned there, but thousands of young people and adults, you know, taking part in those activities every week. Amazing leisure centres, of course, I don't really need to say that, but under massive pressure, you know, just now as well. But we have millions of visits coming through our sites every year, and I think one of the things I'd really like to see in this area is much more of a partnership approach. You know, you've got a list of a dozen plus local authority officers at the end. Let's get some more partnership working involved in this and really make this a really high quality area of development, I think, in the future, but one that is under a bit of pressure. Youth groups as well are another one where really important activities taking place there, and we could do with recognition of that here. So I think this is a decent start, but I think there's an awful lot more we can do, and much more on a partnership basis, and not just the local authority, who I think are going to be under so much pressure going forward that we need to really spread that weight out across the district partners if we possibly can.
Thank you, Alistair. Tom?
Sorry, Chair, I was late, so I'll introduce myself as well. Tom Brailsford, the new Director of Children's Services for Kirklees. Yeah, it looks like some fantastic things are going on, and I guess considering how we can support that priority, just thinking about how we can integrate the approach with our educational settings and our schools, and thinking about them as part of place, because they are part of the local area. And you know, if you need any support in joining some of that up with the schools as community hubs work, and a discussion about how we can do that, more than happy to do that, Chair.
Thank you very much. Anyone else? Yes.
Just briefly, I'm just thinking of there are lots of care homes in our communities as well, and I'm sure we could do some work around trying to open them up a little bit more. We're doing a little bit of neighbourhood working at the moment, but this has made me start to think a lot about, you know, we have spaces. Why aren't we bringing and making sure that the people who live in our care homes can still access community, but actually maybe we should be looking at the community accessing what we offer, and that'll perhaps bust some of the myths as well.
I'm glad it's making you think. I'm hoping it's doing that to everybody in the room, but I think that's a really solid comment and something I'd like to explore more. In terms of things like the place standards, I mean, we use that in my ward. I'll do the same thing, and I'm joyous that we've got a bread and butter thing now in my ward. But one of the things we found was there were so many bits of things happening locally at this small area level that a lot of the workers, whether from health or from the council or the voluntary sector, didn't know about all the things going on. So we've started doing, I think we call it a patch meeting once every 3 months, and we organise a venue. I try and provide cake for everybody, and we turn up, and there's a bit of time for networking between all the people who work in the area, and things like we had a local voluntary table tennis club come along and talk about what they did and how you could access it, and people there, social prescribers, saying, "Oh, I didn't know about that," or "I didn't know that was happening here." And I think that will build on the strength of a lot of this work. But I think Alistair's absolutely right, there's so much more we can do, but it's about the pressure that nobody's short of work to do, are they, at the moment? But I think we should still keep attempting to do that. And I think, like, Tom's offer of links is really important. But, you know, if anybody's wanting to connect with local areas, you know, we can certainly facilitate that to enable other services to be better developed. Thank you for that. Have you more on that? Are we done? So we've got 3 things that we're asked to comment on and help shape. I think people are going to have to do a bit of thinking time to consider how they can support the delivery, and I think that's something we should be coming back and discussing at the next meeting. And I think we've already got some plans about how we keep on looking at progress and identifying gaps. Can I thank everybody who's been involved in delivering that? Thank you very much. So, if we could move on to, I think we're at item 9 now. And is that you again?
No, it's Health and Care Plans, Rachel.
Oh, it's Rachel Milson, yes. Health and Care Plan update. Over to you.
Hi everybody, it's me again. I've got some slides if you would just be able to share them, please. And I'm also going to bring in a couple of my colleagues to do a bit of this presentation as well. So the Health and Care Plan has been shared in the pack for everybody, but I just wanted to pull out some key points just around how we've approached the design to this, because it's been done quite differently, and just some of the key points in terms of some of the development areas in it as well. Okay, so just to reiterate the purpose of the plan, so it's about how we collectively as a health and care partnership will make changes over the next 5 years, focusing on the connected care and support priority primarily that's in the health and wellbeing strategy, but recognising the interdependency with healthy places and mental wellbeing as well. And for those of you that work in the NHS, it also sort of responds to the asks of the operational planning narrative, which was published in December, and that sort of forms the first year of the plan in terms of some of the changes that we want to make. So just a little bit about the approach. So we took a different approach to the development of the plan this year, and we wanted to make sure it was a systems plan that was representative of all of the partners within the health and care partnership. So we've had a system planning group that's led on the design of the health and care plan, and we've had nominated leads from all the different partner organisations that sit on the health and care partnership. We've adopted a principle very early on that we would build on what we've already got, so we didn't want to start with a blank sheet of paper, and that's absolutely what we've done. So we've worked with the programme and transformational leads from across the system to understand what they're doing, what their next steps will be, and really use that as the starting point for the development of the plan. And we've taken a very iterative process in terms of developing something and checking back with people and then developing it and refining it as we've gone along, and continue to work with those nominated leads and with the transformation leads. We've been very much linked into the work that's been undertaken across West Yorkshire in terms of the development of their integrated care strategy and the joint forward plan that is the delivery element of that. So there we've made sure that we've had the opportunity to contribute to that, but also been able to link their priorities back into our plan and respond to those as we've gone along. And again, we've taken the principle that this is a live plan, so although we've signed it off at a point in time, the work doesn't stop, it continues, and we're going to update it iteratively as we go through, and things start to change, so it will be a live plan that's refreshed annually. And at the end of the sort of process, when we'd signed it off, we had a bit of a reflective session. So it's the first time that I think we've come together as a partnership to develop something that we collectively have all signed up to. So we've had a bit of a period of reflection to understand was the things that we could have improved on. Did we make sure we involved everybody that we needed to involve? And we've done that with the system planning group and with wider people as well. So this is just a bit of a run through of where it's been in terms of the different groups and committees that have had the opportunity to contribute to it as it's been developed, and just it was finally signed off by the ICB committee on the 10th of May. And these are the priorities that are within it. So we've got some system-wide strategic themes or potentially programmes they may end up being. And we've tried to sort of reorganise our partnership approaches and things across the life course approach. So we've already got the established Ageing Well programme, but looking at how we bring together the component parts around children and young people under a Starting Well and long-term conditions, and that, under like a Living Well programme. Recognising that dying well and mental well-being cut across the life course approach, and I've got some colleagues that are going to sort of give you a bit more information in terms of where we are with the sort of development of those strategic themes, potentially programmes. And then we identified a series of priority actions, and I don't think anybody would argue with these in terms of things that are really important that we need to focus on. So we've got improving access, we've got a more holistic approach to out-of-hospital care. So when people do require some more intensive intervention, how do we manage that in terms of a crisis response? And then we've got some significant workforce challenges, both nationally and within Kirklees, and how do we collectively come together to respond to those? And through each of those priority actions, we've tried to sort of develop the narrative by looking through a series of lenses which are in the grey box, and I'm not going to go through all of those because there's quite a number of them, but again, thinking about all of the enabling things around digital estates, also thinking about how we focus on improving and reducing health inequalities and the wider determinants of health, and our contribution to things like climate change and other things like that, in terms of making sure that we're very mindful of some of the sort of priorities nationally that you know we need to be mindful of. What you'll notice in the plan is that the first 2 years are very detailed in terms of the changes that we want to make, and the last 3 years are more sort of outcomes based and aspirational, and I think that's just a reflection of where we are and what we know at this point in time. And another key point to make is just that we've made sure that we have responded to all of the Health Watch I statements, so they've been very integral to the development of the narrative that we've put into the plan. So we've been very sort of mindful that sort of they are the things that our members of the public sort of said were important to them, so we've made sure that we've captured those and responded to those in terms of the changes that we want to make. So I'm just going to bring in two of my colleagues.
Good afternoon, everyone. I'm Mark Hindmarsh. I'm the Director of Integration and Strategy for the Kirklees Health and Care Partnership. Thanks for having me along. So shall I let Matt introduce himself as well? Do you want to say hello, Matt?
Hi there, everyone. I'm Matt Whitaker, also part of the Kirklees Health and Care Partnership, working in transformation and integration.
So I'm just going to say a couple of things that sort of lead us into a little bit more detail on these priority programmes, and then I'm going to hand over to Matt to do a little bit more detail. So just a couple of things. So actually it's been helpful this afternoon hearing about the other strategies we've got across our partnership. So as colleagues have said, so these link directly back into our wellbeing strategy. So we're absolutely working closely with colleagues in public health and using that as the basis really for making some choices about where we should put our focus and priorities. And the issues and the areas of focus that have fallen out really of that wellbeing strategy are deliberately chosen because they are whole system issues. So I just really want to make the point: these are not NHS programs. These are not sort of the NHS Integrated Care Board programs for the year. These are our partnership programs. These are things that impact on all of us in different ways, and things that we recognise we need to work on together if we're going to make a collective difference to them. And actually, it's really nice to see a couple of the SROs who are going to lead those programmes in the room this afternoon, who are not actually employed by the ICB, but are going to be leading those programmes on behalf of the whole partnership. The other thing I was just going to say is, actually, sometimes when we talk about all of these different pieces of work, it's really important that we've got some focus and that we've got some collective system-wide goals that we're all agreed want to try and make a difference to. And that's what these are really intended on doing, that give us our partnership, those stated priorities as areas to work on together, and we'll bring people together around them. And then just the last thing I was going to say before I hand over to Matt is, I also just wanted to recognise that it's not like we're starting from scratch. In Kirklees, we've got a legacy of strong partnership working already, colleagues who've worked together in these fields for a number of years. This is about strengthening how we work together and about building on what we've already got across the Kirklees partnership. So I'll hand over to Matt, who's going to give us a little bit more information about those areas so colleagues have got a better sense of what they're going to be about.
Thanks, Mark. So as Mark and Rachel have both alluded to, obviously our health and wellbeing strategy and underpinning health and care plan talks this life course approach to the delivery of health and care. So what we started to undertake at the start of the year was essentially a piece of work to map our current delivery structures to see if we are indeed geared up to deliver on this life course approach. We've had an Aging Well programme that's been established for the last couple of years, but what we've not necessarily had is a fully integrated partnership way of delivering something that would fit within that starting well remit, nor living well remit. We have had a very advanced palliative and end-of-life care partnership, which will naturally evolve into the dying well. But again, it's just maybe thinking about how we can build on the partnership working within some of that. As Mark was just suggesting, we see these as essentially core pillars of provider partnership delivery, and as such, we don't see them as just NHS programmes of work. We want to really kind of facilitate and enable a platform for that provider collaborative approach, thinking about how broader partners around the room today, but also broader partners within our partnership can actually really take the lead with these programs of work and actually own the priorities as their own, as opposed to, you know, kind of attending a meeting on behalf of that one respective organisation. And in this, there's obviously going to be a lot of trust from places like the Health and Wellbeing Board, like the Kirklees ICB Committee, trusting these provider collaboratives to essentially own the priorities within the health and care plan, moving essentially to a shift where we can look to delegate. These are all the different outcomes that are associated with the Starting Well. Here you go, Starting Well programme. This is on you to essentially organise yourselves as a partnership to deliver on the back of these. What this slide is essentially getting at is the underpinning ethos of every single Well programme is going to be that of end-to-end care and that of systems thinking with regards to how we have conversations around opportunities and or issues. So nothing will be handled in isolation of the rest of the system. A few practical examples: education, health and care plans. You could make a case for let's get in more educational psychologists. That's not thinking about a systems thinking approach to the problem. Ambulances outside of A&E. Should we just get more ambulance drivers? That's not taking a systems thinking to the problem. The phone rush, GP surgeries at 8 a.m. Let's get more receptionists on the desk. It's not taking a systems thinking approach. So what we want to enable with these different Well programs is literally a platform that's got the breadth of providers and partners around the table to consider the entirety of pathways, so we can really make change on the part of the pathway that will have the most bang for our buck, to say. And within that, there's absolutely needing to be a focus on the prevention side and the early intervention side of things, but also recognising, of course, there is a space for more complicated cases, and just ensuring that that seamless transfer of care is embedded within the different Well programs. As has been alluded to, and I think is very obvious through what we've been talking about so far, the single most important thing to all this is us working together as a partnership. This is not the responsibility of any single group, any single organisation. If we can't thrive as a partnership, we will struggle to deliver on the back of these programmes. And pivotal in that is thinking about how we can align our priorities so we all recognise the same challenges and opportunities and take action on the back of them. And in doing that, of course, we'll be united on things such as the focus on inequalities, focus on inequity. From a practical perspective, this is really kind of harnessing the notion of collaboration as opposed to competition, and taking advantage of the way that the Health and Care Act has been updated recently to really enable some of this work, and really kind of taking the plunge just to trust our broader partners to succeed on what it is that we're all trying to achieve here. This is just the last slide for me, and it just gives a bit of a snapshot as to the journey that we've undertaken so far. This is by no means a piece of work that's been done in a darkened room. This has been absolutely done with the broader partners. Engagement's been the key word. Mapping's been probably one that's followed that. With an absolute emphasis on building on what we've already got. So, for example, with each of the Well programmes, take Starting Well for an example, we have mapped the children and young people's space. We have worked with children and young people's leaders, colleagues that work in and support the system to take a view of what all the different parts of the system do, how they interact with each other. Is the attendance right? What's the partnership working right? Are the priorities right? And in doing that, we're thinking about how we can evolve that piece of work to become a strategic Starting Well theme that really talks to our whole partnership. So the very last thing I'll say is we've got to a position now where, following the mapping and the engagement, we are undertaking a range of workshops to think about what literally are the things that we're going to focus on and how are we going to do so. And we're working on proposals that are hopefully going to be developed within the next month or so to have these programmes established, hopefully by autumn time, fully delivering. The ultimate ambition being, as I think I mentioned earlier on, when pieces of work such as the Health and Care Plan come out, we can literally say, Starting Well, these are your priorities, you're now responsible for delivering on these. Living Well, you're responsible for delivering on these, so on and so forth. So that's everything I've got to say. I'll pass back over to Rachel.
So just a few last points from me. So just some key points from the plan. So again, I think we've said this quite a few times, but the plan absolutely builds on what we're already doing. So a lot of the detail in years 1 and 2 shouldn't be new to people. It should be stuff that, you know, we're all sort of aware that we've been working on. There are some elements of the plan that I think, you know, if we're honest, we don't have all the answers for at this point in time, and I think that's okay. And some of those areas are listed there, and we've been quite honest about that in the plan, and we've got, you know, things in train to sort of work more collaboratively together to think about how we collectively come together under some of those areas that are listed there, and think about what's our collective approach to addressing and moving forward on some of those areas. And for those areas, we've talked about our aspirations and our processes for finding some of that detail. And then when we come to update the plan for next year, we'll hopefully have some more detail to put in there against some of those areas. So just in terms of next steps, so the version that's in the pack today is the version that was developed for the partnership. So there's a couple of different versions that are in development as we speak. So we're having one that will be published on our website, which is compliant with the accessibility standards. We want to do a very short summary, which we can share with partners for use within their organisations. And we're doing a public-facing summary, which is much more sort of plain English, very easy to understand. And we've got that ready, and that will be shared at our public engagement event, which is next week. So we've got a couple of different versions that we're going to share around with partners. Obviously, conversations are progressing around some key elements of the narrative that are still in development. There's a piece of work we need to do around being really clear on our measures for success, which I think the plan's quite light on. And we're waiting for some information from the Joint Forward Plan for West Yorkshire so we can make sure we can map and align all of the metrics together. But that's something we really need to focus on for the rest of this year for the next version. And we also continue to engage and to work with the West Yorkshire Strategy Design team to make sure we've got that alignment and that triangulation back up to West Yorkshire. That's everything.
Thank you very much. At page 50 of our papers, if you've got papers like me or online, asks us to receive and be assured by the plan and note the outstanding areas which are still in development. I don't know if people have any questions or comments they want to make at this point. Carol.
It's not a question, it's just a comment. I've been saying in a few meetings in the last couple of weeks that, just to remind people, on Saturday the Health and Care Partnership will have its first birthday. The ICB was formed on the 1st of July last year. And I just think it's great at this point to be able to present something that feels like a really integrated plan. I think it was Mark made the point about there are, you know, senior responsible officers for the programmes that sit from a variety of organisations in the partnership, and it, having seen this developed over a number of months, it does feel really different to the days of commissioners and providers all doing their own plans and hoping that they matched up at some point. It's felt like a genuinely partnership exercise, so just want to sort of reiterate the thanks to all the partners that have been part of it and commented on it. It's nice to have got to this point after in year one.
Well said. I'm not seeing anybody else indicating, so while people are just absorbing all that and thinking about it, I'll make a few comments, or if I may. I smiled to myself when you said you were preparing a plain English version for the public, because my question is, why can't we have a plain English version? This is a meeting held in public, seen by the public. We are the public, and I'm very much an ordinary human being who welcomes plain English at every attempt. But just a comment as such. The measuring success interests me, and you mentioned about the 8 o'clock telephone rush at GP surgeries, and I'm well aware of some of the changes with my own GP's practice. I suppose, for me, a measure of success would be a feedback loop from the users. What does it feel like? I have to tell you, when I sat on the phone, not at 8 o'clock in the morning, one afternoon for an hour and a half, and then the automated system said, our phone lines are very busy, and cut me off, I wasn't thrilled. You know, and that's a one-off incident. I'm not saying that's a problem, but a feedback loop from the community from users would be really useful, because that will help improve. I think there's some great improvements I'm seeing happening now, but I think they could be improved more. And getting that feedback will be helpful. And I was incredibly pleased in the list of priorities in the presentation, really, which was looking at applying a poverty lens, if you like, about what was being done. And I think, you know, from the earlier items we've had, that is absolutely essential. So I was really grateful to see that. Anybody else? We've two. We'll start with Mark and then Tom, please.
It's just a question to you, Chair. I've got so many different questions on different topics so far. Shall I cover it? Shall I cover the 3 or 4 questions at A or B? Is that okay, or...?
Well, we've still got people definitely sat in the room. Do you want to give it a go now, Mark?
You want me to do it now? Right, okay. Okay. I have a lot of admiration for the public health side of council and the country as well. I mean, if you look at some of the statistics over the last 100 plus years, longevity is 97% down to public health rather than medication. So I think that we do need to spend time, effort and additional money, which obviously we don't have, but we need to find it from somewhere, because it's where we do get our longevity from, you know, even from silly things like seat belts, tax on tobacco. It's all down to public health rather than medical assistance. So we do need to find and listen to people from the public health intently, because more often than not, and as it has been proved over the last 100 plus years, it's where we get it from. So on that, there was a few things in the public health, in the Health and Wellbeing Board reports, and what hasn't been said today that I wondered if we could add, cover, or do some work with in the near future. One is back to medication, really, or what I would class as over-medication. I've saved this for 2 years. This is, my father died during COVID, so one of the things that you do as a child is go empty the house. This is medication. This is saved for the last 2 years to show that a father who was 92 years old that didn't really need any medication. He had no heart problems, he had no blood pressure problems. The only thing that he had most of his life growing up in Bradford was asthmatic problems. So this is the medication that he had spare that was left in his house. So I think that as far as we, as a Health and Wellbeing Board and Public Health, we need to look at what sort of medication is being given repeatedly to people that might not be necessary. A, because of general health of those people that are taking it, and B, the cost of those pills, tablets and other medication that's being given to people that might not be necessary for such a long period of time. I can throw them away now after keeping them for 2 years, but I did want to keep them to a public arena rather than doing it on Zoom. I didn't think it would have the same effect. So the other thing is hormone checks. One thing that I feel is missing and has been missing for years in our medical profession is checking hormone levels for young teens, and on the other side of the spectrum is menopausal women. One of the reasons that I mention this is I'm 64 years old. My middle son is 21. My 2 levels of testosterone that can be measured easily are twice the level of my 21-year-old son. I mention this because low testosterone and estrogen levels in young females create anxiety, depression, and ultimately suicidal thoughts. But what we don't do is we don't check estrogen or testosterone and other hormone levels in young teenagers to see if everything's balanced. What we then do is if a young man has difficulty concentrating, which is another symptom of low testosterone levels, then we might put a banner on him of ADHD and then put him on medication, which is a spiralling effect that might cause other symptoms and actions later on in life. We are getting to a point where what the class as military-age young men, 21 to 40 years old, one of the highest rates of death is now becoming suicide. So maybe it might be a priority rather than left on the shelf as something that we think about or allow other people to think about. So that was one of the other things that I wanted to mention was hormone levels. And the final one was food. We talked about bread and butter, which is perfect, but the only problem is that the white stuff is probably the most dangerous stuff that we can eat. That's white processed flour, table salts and processed sugar. It does create as many, if not the most problems as far as people's weight problem, then creating malnutrition and also creating obesity. So what happens then is we've got health problems from people not having the right education as far as balanced diet's concerned. So what we tend to do is leave that to the individual. Where I remember growing up, there was quite a lot of public health ads and information about how we should eat. But then when you look at some of them, they are poor to say the least. They are ill-informed and they lean towards people's natural inclination to food addiction. So that might be bread, processed bread. So I think that those three things, over-medication, hormone checks and eating, at some point in the Health and Wellbeing Board report and moving forward should be added in for well-being for all the population. I am covered menopausal women, but I mean, I've been married to one, so I know firsthand the challenges. I've also got 4 of our closest friends who have been divorced in their mid to late 40s, and in every single one of those 4 cases, it was down to menopause. That wasn't treated, it wasn't diagnosed correctly, it wasn't treated properly, and it was ignored by the medical profession. So I think that that is another aspect of the hormone levels. I think I've vented enough, Chair, but thank you for listening.
Phew, thank you very much for that. I think your comment about hormones raises an interesting point, particularly in terms of potential suicide outcomes. I don't know if there's any research on that or as such, but perhaps that could be looked at. I haven't a clue what to do about your medication issue. Experience is I frustratingly feel my medication for something I have to take for the rest of my life is restricted to every 2 months, which drives me potty when I'm going on holiday and I'm trying to get the right supply. So I don't know how that has occurred as such. But perhaps the issue about hormones might be looked at. I've no idea if there's any research. I know what you're saying is very valid and true to you, Mark, but, you know, that's an example, isn't it, and not necessarily something that's a truth as such, or in a broader level. Alice, do you want to speak?
Yeah, thank you, Chair. I think one of Councillor Thompson's really key points is the focus that we should be moving towards, which is much more about prevention than care. And however fantastic the NHS is in all its shapes and sizes, it does wait until people get ill and then it tries to make them better. And we need to move towards educating people, I think, as Councillor Thompson picked up on, and then treating people in a more preventative way. Falls prevention is a good example of that. If we can stop people falling in the first place, that will save us an awful lot of money and will be much better for people's quality of life. Physical literacy of young people is another fantastic example. If we can encourage them to be active and to stay active, that is a much better outlook than sitting watching video games all the time. So I think that shift of prevention, and especially in the longer term strategies, should be surely something that we are working towards. I think that would be of the benefit of everyone, and it would be financially much better for the country as well.
Thank you. Tom?
Thanks, Councillor Kendrick. It was just a question, Rachel, and you said it's a live document. How live is it? Because I guess, given the fact that me and Mark are kind of moving on the Starting Well agenda, we're not far off those priorities, are we? And it'd be really good to be able to update that. And I know there's a process, so I'm not expecting you so we can just kind of update it, but we maybe need to just have a think together about how we can do that.
Yeah, I think we're aiming for Q3 to do a full refresh, but there's no, the way it'll be presented on the website means that we can update it iteratively as we go along.
Thank you. You want to come in?
Well, I mean, I suppose it's really more in relation to Councillor Thompson's questions. I just wanted to reinforce with colleagues the close working relationship that we have in the ICB with our colleagues in public health, and also to say that as we're starting to consider what the specific things are we want to try and make sure we have some focus on and we deliver in those well programmes, prevention and how we make sure we are sort of trying to achieve that. People call it the left shift, don't they? But trying to think about how we stop people becoming unwell or supporting them to remain healthy is an absolute priority for us. So, as I was saying earlier on, we recognise, I always think like the fundamental thing that is impacting on the NHS is too much demand and not enough staff. And those are things that the NHS actually has quite limited control over. We must work with our partners better. We must consider things like healthy eating. We must consider how we can link into some of the initiatives we've heard today across the NHS to do some of those things better, and we're determined to do that through these programmes.
Thank you very much for that. I do acknowledge that the NHS needs no more work than it's got already, and I'm sure is committed to prevention. Sadly, the things that you talked about, particularly around diet, Mark, are really impacted even more by where people are in poverty and struggling, because that's the cheap stuff, or that's what people feel is the cheap stuff they can find and buy. Do you want to?
Just to come in to thank you for your comments and your support for public health and the impact that it has, and to kind of reiterate what Mark was saying about the relation. I think we're in a much better position now, like what Carol was saying with the ICB and that the integration between ourselves within the local authority and the ICB than we were a year ago. In terms of some of the specific points, I can certainly pick up my colleague around your point around mental health and the menopause and relationship to suicide. I think part of the thing with the menopause is also the stigma of menopause and talking about it, which doesn't happen. So I think that's part of it as well, because it's just something which we don't talk about as in kind of society. And I can only talk for the local authority. We are getting better at talking about the menopause, like having menopause champions and things, which include men as well. It's obviously very important. It's not just a women's issue, is it? So. Yeah, so just to pick, I'll speak to my colleague around the suicide and mental health aspects of menopause, and also in public health. Obviously, we do a lot of stuff around kind of obesity and kind of healthy environments, and obviously, like Councillor Kendrick has said, it also has huge relationship to like your area and where you live and your physical activity. It's obviously very complex, but there is more stuff that we could be doing kind of across the system to join that up.
I'm absolutely sure that Councillor Thompson will be continuing to ask these questions at future meetings, and I welcome that. Thank you. Can we therefore, are we happy then to move on to the next item, please? It's Rachel again.
Sorry, it's me again. This is my last one. Okay, so again, I think if you just continue on, there's just 2 slides around the West Yorkshire Joint Forward Plan. It's on the previous presentation. Okay, so just a quick 5 minutes on the West Yorkshire Joint Forward Plan. So just in terms of its purpose, so it outlines just while you, oh, brilliant. So the West Yorkshire Integrated Care Board developed an integrated care strategy, and that was finished, I think, in January of this year. And a nationally mandated requirement is for all integrated care boards to develop a joint forward plan, and that basically details how they will deliver upon that strategy. So our health and care plan, the document that we've just talked about, supports delivery of the strategy alongside the joint forward plan. So it's sort of like the integrated care strategy sits at the top, and then it's got sort of a place-based response and a West Yorkshire response, and the two knit together. And our health and care plan will be included as a link within the joint forward plan. And we've purposely run our timescales in parallel with the West Yorkshire timescales, just so we can make sure we've got that connection between the two documents. In terms of the development process, again, it's been very similar to the way we've developed the health and care plan. So there's been a strategy design team that was established at the start of last year, and that's had representation from across all the 5 places within West Yorkshire, and also from within all the programmes of work that are sort of led at a West Yorkshire level. There's been a public engagement and consultation process that was supported by Health Watch, and that was a campaign that was undertaken in early 2023, and that helped shape the narrative. Kirklees has been an active member of those discussions, attending workshops and online events and contributing to the development of the narrative. And we've also had links, so we've got within the places we've got the links in terms of the programme, so they've been very much connected into the West Yorkshire programme leads as well, so that they've had a handle on sort of the narrative that they've been working on as well. So there's 2 things that are included in the paper, and I apologise because it's a very lengthy document. So there is the covenant, which is an ICB covenant, and that outlines the national requirements around the need to develop the plan and what needs to be included in it, and also the process that they've undertaken. And then there's a draft of the plan that's included in there, and that was correct as of May. So the West Yorkshire team, it's an ongoing refinement process. They're aiming to sign the final version of the plan off on the 18th of May at their board, and then launch that alongside the integrated care strategy on the 20th of July. And in terms of that ongoing process and keeping that document live, because again, what they're advocating is that it will be a live document and will reflect changes as they happen. There'll be quarterly learning system that wanting to become a learning system, so there'll be quarterly improvement events from which anybody from place and programme can attend. And the first one of those is scheduled for the beginning of August. So that's going to be sort of keeping the conversations around how we're delivering upon the integrated care strategy live, and what kind of things we're doing within place, and what kind of things back into the design team if people have any specific comments on the narrative that's included.
That's your get out of jail card, is it? Well
done. It is
done.
a little bit, yeah.
Thank you for that. Can I just draw colleagues' attention to page 88, the recommendations that were asked to note and comment on the initial working draft. That was the members of the Integrated Care Board as such. I don't know if anybody has any comments as such on the document today, or any questions that Rachel is going to take away. Tom?
Actually, a positive comment about this. It's really good to see a lot of the regional documents don't necessarily reflect the priorities for children and young people, and actually there's quite a comprehensive section in there, particularly around early intervention and family help. So, you know, definitely, and I know there's been quite a lot of engagement around that, Rachel. So I guess, you know, from my point of view, it's really good to see that reflected in the document.
Thank you for that. I'm not seeing anybody. Oh, Alistair is wanting to come in there again.
I'm sorry, Chair. I think it's the same as your comment in the last document was just where's the success? You know, how are we going to see success with this, and how is it going to make a difference to people in Kirklees? You know, I think that's the key thing that we really need to have here. And I'm looking forward to the easy read version of this one, I must admit.
Thank you. I think that is key to it all, as to how we know what difference has been made and how we know if it's a successful difference. But all to play for. Thank you very much. Can we move on then to the item on climate change strategy, and hopefully by the magic of IT, the presenter for this is online and is going to join us as such. Before colleagues leave the room, can I just thank everybody who's contributed and presented and answered questions. Thank you very much. So, over to you then, Shannon. You're currently on mute at the moment, I think.
Yeah, sorry, I knew I was. I just couldn't tell my computer to upload the PowerPoint and change off of mute at the same time. Hopefully you can hear me now, colleagues.
We can indeed.
Is that any good? Ah, excellent. Thank you for confirming. So, and are the slides visible in the room?
They are. Well, I can see them. I don't know what's... Yes, they are, but both on the big screen and my small one.
I'm going to hope that they are. I can see them. Thank you to board members for inviting me to come speak to you today and allowing us to have this as an agenda item. So I'm Shannon Kennedy. I'm a public health specialty registrar on placement in the climate team, which is part of the improving population health team within the West Yorkshire Health and Care Partnership, or ICS. So I'm going to talk to you about the climate change strategy that went to partnership board in March as a sort of working draft. And so the next phase for that we agreed with partnership board back in March was to take this working draft out to colleagues in health and wellbeing boards for engagement and sort of comment. You may also have heard about this either if you were in attendance at the board meeting back in March, or if you've got links through to or are Director of Public Health. So we've also shared it directly through to the relevant Directors of Public Health in West Yorkshire. I won't belabor the points of the document itself because that would be out with the time that we have today, though I have provided that link for the papers for any sustainability that can dovetail with the strategy refresh process for the whole of the ICB and ICP that's just taken place through the past sort of 6 to 9 months. And we felt that in the climate team, this was a good time to also look at refreshing a climate strategy itself that could be part of that wider strategy work. So it's looking at how the whole system can have an ambition on climate and sustainability, thinking about using this donut model. It's an economic model for managing the trade-offs to make sure that there's a floor so that people's needs are met that doesn't go beyond the ceiling of what the planet can really sustain. And also, we used it as an opportunity to get the risk management framework for the Health and Care Partnership to consider climate. So we're taking a risk management approach to climate just as we would for service disruptions or extreme sort of emergency events and things like that. And that's because climate change is already having an effect. So it's already a problem for people in Kirklees, across West Yorkshire and across the world today. And we know that's going to accelerate. So the purpose of the strategy was also to provide some interventions and actions at a high level across the health and care partnership, not just within the NHS bodies that make up the partnership, but for everyone, because of course, climate change issue isn't something that's just for the NHS to tackle. It's not something we can just do things about. And it's something we in the ICB very keen to work with all of our systems partners to address at West Yorkshire level. I think you'll all be familiar with some of the effects we're already seeing here in West Yorkshire and in Kirklees. We have some examples here from across West Yorkshire, but we've also had unseasonable heat just a few weeks ago. We had something like 3,000 deaths in people's age 65 plus last summer in our heat waves, and we know this is accelerating. So we're seeing effects in the health service and in well-being in general for our people. So as part of this strategy, we provided a menu of actions that we could start to take at a systems level. It's important to state that these actions are intended not as a mandate, but a sort of starting point. So if all of those actions were taken, the system would be in a substantially better place than it currently is on not just mitigating, so reducing the climate harms that we are already causing by just the actions we do because we live in a system that uses a lot of climate harming fuels and anesthetic gases, something like medication and overprescribing, which has already been discussed. All of these are sort of hard on the climate, but also thinking about adaptation and how we shore up our systems and communities for what is already happening and will accelerate. So we tried to give some really concrete points because our stakeholder engagement in development with things like our sustainability colleagues working across hospital trusts made it clear that people wanted some specific ideas about things that the system could do. So it's something that people at a personal and organizational and place level could work on, but starting from quite different points and taking account of the fact that all of those different actors will have different priorities and barriers and constraints about how they approach the work. So it's also useful to just demonstrate how much work really needs to be done and how urgently we need to act if we are going to get to where we need to be in terms of our local targets on things like net zero, our national requirements under things like the Climate Change Act, and also just what the models and predictions indicate we need to be doing to keep our communities safe and getting them climate ready. So in terms of the requests we're going to make of you as a board and board members, the first piece is just engagement and support to be aware that this work is going on, and we would love for the support from yourselves, I guess, with the idea of us all acting as a system on climate, seeing it as the #1 risk to human health, which that has been determined through the data. The Lancet has, I think it's probably 2 years ago now that was the Lancet made that claim, and we've just seen further and further evidence of it. So it's your engagement and support, and also considering the actions on that menu of options that I mentioned, and thinking about how that might work in terms of taking ownership on climate and biodiversity at a place level. I think, so I worked with Frank Swinton, who's the climate change lead for the ICB on this. And Frank and I are really keen that this isn't just something the ICB owns and drives, and that this becomes owned jointly across the system. And that's something that Partnership Board echoed, and that is what we're hoping to do by coming out and having conversations with people about sort of the specificity of how that strategy might happen. There's also an option to make a pledge and promote the All Hands In campaign that was begun last year, and that's ways for people to make simple personal pledges about how they might act on climate and biodiversity. The idea that it's big and it's complex and it can be perhaps quite scary, but also there are little individual ways we can all start to kind of break down some of the challenges and take action on them. And then I wanted to pose a question to the board about what you felt you might need from us as a climate change team to help around sort of realizing a strategy that would make us, leaders here in West Yorkshire on climate mitigation and adaptation, so that we have sustainable, safe communities. And And that's all I'm going to speak at you about today, because I wanted to leave plenty of time for comments and questions from the board. I'll do my best to answer them. And I just wanted to thank you very much for your time and mention that if you had questions or feedback after this meeting today, I would recommend you contact my colleague Frank, who is the climate change lead. He's got a permanent post in the ICB, whereas because I'm a trainee on placement, my time is limited, and I wouldn't want you to email me and not get a response because I'd left post. So yeah, thank you. I would love to hear any questions from the room if I could.
Thank you very much, Shannon. I assume that presentation can be circulated around the board as well, can it? Yeah, if we can have a copy of that as such. Any comments or questions, colleagues? Councillor Mark Thompson.
Thank you, Chair, and excuse my ignorance. How does climate affect weather?
But which mechanism are you interested in? So, I mean, we know from the evidence that changes in the climate, things like an increase in the particulate matter of greenhouse gases in the atmosphere, are leading to an increased average temperature, both of land and in the ocean, and that is leading us to have more extreme weather. So we're having more droughts, more extreme rainfall. That's particularly in the UK. The specific way that it works is slightly different from place to place. But in the UK, that means wetter winters, hotter, drier summers, and the increase of the risk of those extreme weather events, things like flooding and wildfires. So it's the increase of the atmospheric particulate matter, which has impact on, like I say, the average temperature of both land and sea. But I mean, I'm not a climate scientist. I'm here really to talk about the links between climate change and health.
Thank you. Richard Parry. You'll have to come and find a microphone. Over to you.
So it feels like there's a lot of activity going on across multiple systems around climate change. I just wondered how this joined up with the work that, for instance, the West Yorkshire Combined Authority is doing on this, so that we kind of, I guess we've got good alignment rather than the possibility that either individual organisations or systems are playing into multiple pieces of activity.
Great, thank you so much for that question. We were also doing this as we started the work. So I think one of the key pieces when I picked the strategy was to take it from being an integrated commissioning board, so an NHS-facing strategy, to something that would go to the partnership board, become a systems strategy. So one of the key sort of pieces that they're asking for is a strategy that is whole systems based, to ensure that there is linking up. Because the combined authority is a part of the wider health and social care system, the intention is that these things will be able to dovetail and at strategic level agree. The specificity of the actions is, as I say, in the way that we've tried to set them out, is something that should be able to be enacted or interpreted in ways that are suitable for the particular sort of context and situation for different systems partners. So it should be seen as something that helps improve the cross-working that's already happened, linkages between different systems partners, whilst obviously this one has sort of ultimately been born from an NHS perspective. I'm a public health person, my background, I'm on placement in an NHS organisation at the moment, so I'm especially conscious of the fact that this needs to be a whole systems approach. So the NHS bodies are quite concerned about and so the ICB is thinking about the health impacts of climate that will be felt within the health service. And we have the opportunity with this strategy to make it clear that the ability to influence the sort of mechanisms or the causes by which that would occur, really a lot of it actually sits out with wider partners like the combined authority. So simply to sum up, to say that that's very much something that Frank and I would agree with you about. It's important that all of these dovetail, and the way that we hope we've written this strategy and the kind of discussion we had in partnership board when we shared this strategy was that that's what this should help foster, rather than limiting that or enforcing any kind of siloed working. I hope that answers your question.
Thank you very much for that. Anybody else? At the back first, then you, Mark.
Hi, I'm Liz Mear. I chair the Integrated Care Place Committee, and it's really great to see the report and hear this topic being discussed here. And I was particularly struck when you said how many people died in the heat waves last year, and that affects families of Kirklees, doesn't it? It affects all of us here, it affects the work we do. So I'd be really keen, and I'm looking at Carol, our Accountable Officer, to have some sort of focused presentation at the Integrated Care Place Committee to think about how we plan, use the actions in the paper, because I think we can do that to think about sustainability, but how do we plan as partners so that we tackle some of these things together and take really practical actions to support people.
Okay, thank you. Is there anything more you'd like then for me to say that I've taken note of that and I'll share it with the climate team, or is that sufficient?
That would be great, and I think Carol and I could coordinate with your team to sort of maybe bring it to all of our development sessions and sit down together and look at how we can plan some practical actions.
Sure, please do get in touch. Yeah, because I think that's one of the challenges of doing it at ICB level is there's lots of big national stuff. There's often lots of good, very local work, and it's this kind of middle level of trying to stitch those two things up. So that would be great. Thank you.
Okay, thanks, Shannon. Cool.
There you are, an invitation already, Shannon. Councillor Mark Thompson.
Thank you, Chair. Just a question about the burden on the NHS. I just wondered where we could see the statistics and the evidence that it is going to be a burden on the NHS, you know, where the information comes from, if that's okay.
So there are references through the strategy itself. I'm off the top of my head, I'm trying to think. There have been pieces of work. Well, so, I mean, we know that things like people having increased episodes of, let's say, brittle asthma from poor air quality, which is linked to things like heat waves. That's one example that's used. I think it depends on what kind of data you're interested in. What we probably don't have good reporting on at the moment is at, say, a place level. We would probably have things at a national level. So things like the number of deaths that I mentioned, that's ONS data. So the Office for National Statistics has collated that at an England and Wales level. And that's usually the level that we are looking at the moment for being able to make those linkages. But what there is probably more of a possibility to do at a more local level is to start flagging the kinds of conditions we know have good links with climate change. For example, so cardiovascular ill health, heart disease, things like that. We know from just the wider research literature, there's a clear link between heat waves and increased risk of either morbidity or mortality. So people needing hospitalization or sadly dying when we have heat waves. And that is the sort of linkage it might be possible to make in the data at a more local level, to just look at where we would have outlying or sort of unusual increases in hospitalization around those conditions. But I'm not aware that that work is being done locally yet, simply in part because we know we're having the extreme weather, and we know from the wider research evidence that that extreme weather has an impact on health, and particularly people with certain kinds of pre-existing conditions or vulnerabilities in their health. So I think the desire is to think about taking action, whilst also in the background trying to particularize the data more closely to a place, not necessarily waiting for one to happen before we do the other. I don't know if that is useful at all. I know it's not exactly what you asked, but I hope it explains a bit of why I can't just point you to a single source that would say this is the sort of local compilation of that data. As I mentioned, air pollution we know is linked. Basically, worse air quality goes along with things like high heat days and the particulate matter in the atmosphere that is actually the stuff that goes up there from things like burning greenhouse gases. There is some public health outcomes framework data that is publicly available that tells us a bit about people who are experiencing ill health due to poor air quality. But as I say, it's at a local level, there's not a calculation saying it's sort of X many more people with asthma that we definitely say is due to climate. It would be a matter of taking those numbers locally and saying what we know from the research evidence is that that might increase the risk of X condition. You know, for every degree of heating, we would see this many more deaths from extreme heat in people with congestive heart failure, and applying those to the local numbers of people who have those conditions. And that work, as far as I'm aware, hasn't been done. But we know the principle is sound, if that makes sense.
Thank you for that. I think Alex is wanting to come in on that as well.
Hi, so I think just as you were talking about before, about we've got sort of very high level strategies and then some very local ones as well. So the Kirklees Health and Wellbeing strategy is part of a set of top tier strategies that we are doing amongst local authority, and one of those is the environmental sustainability strategy, or the last time I checked that was what it was called. It may have changed name since then, but that essentially we have links to a set of strategies that are talking about the interconnectedness of climate and health and well-being and all of those sorts of things. So I'm wondering as well if there's an opportunity to make links to the work that you guys are doing as well, if that was something that you were interested in, then it would probably be a good outcome of this board as well, if we can move that work along in that way as well. And that's it. Thanks.
Well, thank you. Yeah, I mean, I guess it would be useful to think about what that looks like. If that's something you're happy to maybe start having some discussions with us in the climate team about, that sounds really sensible and valuable. So yeah, I mean, thank you for suggesting it. And I think you're right. It's something about getting the specific areas of focus right, but it's also thinking about the scale of that action. Like, what is the scope that makes sense at place versus at system versus regionally or nationally? So yeah, I think that would be a useful conversation. Thank you.
I'm not I would just, oh yeah, Alistair, I wasn't sure you were signalling.
Yeah, I'm going to have to comment on this one because out of all the agenda points that we've talked about today, I think this is the big agenda. For our children and our grandchildren, maybe not for us old fogies in the room, but this is the big one, and we should be spending a lot more time and focus on this. Unfortunately, most of us are trying to make ends meet, whether as individuals or as organisations, and that's proving really difficult. But if we don't do something about this, we're coming towards 2030 and the tipping point very, very quickly, and there will be no way back if the world temperature increases. And poverty across the world, food shortages, increases in sea levels, all of these things will have a massive effect on maybe not us, but on our children. So it's a really good report, and I wish we all were spending more time really looking at this, and this should be top of our agendas going forward, I think.
I think you're absolutely right, Alistair. Not wanting to extend this conversation too much longer, because I know we've one more item to do, a short item, but I'm really sort of interested in the transport bit. I had a look at the actions that were put in there. As large organisations across our partnership, we, because of limited resources in terms of people to do the work, limited resources in finance to support it, we tend to withdraw into more and more single places, which actually puts a lot of pressure on our residents then to have to travel to those places. And if you add in the complexity that we have of public transport in West Yorkshire, which I know Wicker are trying to address, but you know, bus companies constantly send me messages about yet another route removed from my ward, and I have elderly residents saying, how do I get to this place, that place, the hospital, the doctors, go shopping and all that sort of thing. I really think transport is a very, very complex thing, and I think as organisations we need to think about when we come up with cunning plans to hold safe our limited resources and get them in one place, what impact we're having really on the whole climate issue as well. So I think that's something I'd be very interested in looking at in the future, having experienced it recently as well. But I don't see anybody else with questions or comments, Shannon. Can I thank you very, very much for your presentation? Are we going to have a copy of that we can share across the board?
The slides?
Yes.
Yes, yeah, happy to share those. And also the prior comment about cost of living, just mentioning the tension or the perceived tension about cost of living and climate. Some of my colleagues have produced a paper for the Faculty of Public Health on thinking through how those two things are actually related and how we have to tackle one as well as the other. If the board would be happy to receive it, I would include those as well. It's not directly about my point, but for wider interest in reading, I'd be happy to include that also.
I think that would be very welcome if you could send that to Jenny, please, and we'll make
Thank
sure
you.
it's shared. Can I thank you for your time and your presentation and your patience as well? Thank you very
so
much
much for your engagement.
Thank you. Bye. So we move to the last item on the agenda, which is the tobacco control, local declaration on tobacco control, and coming towards the microphones. You press the large button in the middle.
There we go. Okay. No. It's that one. That's it. Yeah. Thank you. Right. Thanks, guys. I'll try and keep this quite short because I'm sure that people have got sort of places to be. But my name's Becky, and this is my colleague Pretty, and we work on the substance misuse and the tobacco agenda, which is why we're here, in public health at the council. And we just wanted to come and give you a quick update on the local declaration on tobacco control, which we've recently signed up to as a council, what that means and how that kind of translates into sort of what we're doing locally. I did come to the Health and Wellbeing Board virtually, I think a couple of years ago when we first set up the Tobacco Control Alliance, so it sort of just feels sort of like timely to sort of come back and sort of update you again. Can you just move on, please? What? What happens now? There we go. I'm not used to this. Right, okay. Oh, look at that. I feel like Chris Whitty. Okay, right. So I'll not go on about this. This is the sort of some of the prevalence data within Kirklees, which I'm sure many of you will be aware of. But I suppose really to draw your attention, you know, we know that smoking is associated with, you know, with deprivation. It is a huge sort of cause of and associated with many sort of our inequalities within the district and nationally. Around just over 12% of our adult population smoke, but that is higher in certain wards within the district, which mirror deprivation. And the sort of the financial impact is significant, not only on the sort of like social sort of care and on the sort of system, but on the individual as well, in terms of people spending on average about £2,000 a year on cigarettes. The impact as well is obviously seen within primary care and within social care, with smokers requiring more sort of support from those services earlier. We know that smoking is the leading cause of preventable cancer, and that sort of there's the intergenerational impact as well in terms of where children live in households with smokers are more likely to take up smoking later in life. I think it's probably also important just to note that smoking is not a lot. Smoking is an addiction, and as much as it can be perceived as a sort of lifestyle choice, actually the majority of smokers do want to quit, and so it's sort of obviously our job to sort of support them to do that as easily as possible. So one of the things that we're sort of excited that we've managed to sign up to as a council is the local declaration on tobacco control, and this is just a sort of statement of commitment really as a council that this is something that is really sort of important to us, and that as a council we're committing to taking a comprehensive sort of action to address the harms of smoking. And there's sort of like three things really that's part of this we've sort of committed to. So one is around acting at a local level to sort of reduce the smoking prevalence and sort of address the health inequalities. One is around developing plans and working in partnership with our local communities and partner organisations to address those sort of harms and the causes and impacts of tobacco use. And thirdly, to sort of participate in sort of local and regional networks, which we do. In terms of, I guess, what's new and what we're sort of working on at the moment, so just sort of over the last sort of 12 to 18 months, I've sort of listed them here, sort of again to just pick out a few. We have commissioned a vaping device offer within our stop smoking services. The evidence is supportive of use of vaping devices as part of a quit attempt for adults who smoke, and that is sort of within sort of recognised NICE guidance that is a sort of really useful offer and really kind of helps people who sort of want to choose that method. So that is available within the wellness service and within Auntie Pam's, and we are sort of rolling that out as well within some other areas. So for example, employee healthcare, it is available within that as well. We're doing some work with schools. We got some funding through the Core 20+5 work in schools, and so we're undertaking some insights work currently with young people and their parents and teachers in North Kirklees regarding attitudes to smoking and vaping to help sort of inform that offer. And we are also developing a smoking survey and campaign for LGBTQ plus communities, because we know that rates of smoking are higher in that community as well. Prit is also doing quite a lot of work with homes and neighbourhoods around supporting people who live in social housing, because we know that rates of smoking are significantly higher than people living in social housing as well. This is we've sort of developed I think we've called it a one-page plan, but it's a two-page plan. But I suppose it's one page if you print on both sides, where this is our tobacco control sort of plan, and the overall aim is in line with the national plan to reduce smoking prevalence to 5% by 2030. There's a small typo at the top, but it's to reduce it to 5% in line with the national target, and around sort of empowering people to sort of create those sort of safe and positive changes that they need. So we've highlighted the key target groups and sort of how we're doing that. I'll not sort of go on about that too much now, but how that's sort of informed by the evidence and is led by our Tobacco Control Alliance, which meets quarterly. And these, which is very small, but basically the three strands are around supporting people who smoke to stop, preventing people from starting smoking, and sort of smoke-free Kirklees, so really around the sort of normalising smoke-free spaces around, you know, schools and playgrounds and events and things like that. So this is the local declaration, which was signed off. It was signed off by Jackie Gedman, by Rachel Spence-Henshaw and by Councillor Pandor a couple of weeks ago, which is, they were sort of the signatories that were sort of required as part of this, and it was launched to coincide with World No Tobacco Day. And we just wanted really to sort of come along and just sort of let you know really, and just sort of say that we've signed up for it, and that actually, whilst we've had sign up by these people, actually it is a council commitment, it is a sort of district commitment, and as part of this we just sort of want to ask you as the sort of Health and Wellbeing Board to sort of continue to support the tobacco agenda and just sort of keep it in mind, I guess, within your sort of networks and conversations, and advocate for tackling smoking within your sort of communities. That is all. Thank you.
Thank you very much for that. Anybody got any comments or questions? One there, then Mark.
Hi, thank you very much for that. I'm Vicky Pickles from the Acute Trust. Okay. And it's quite timely this, because this week we've just announced our tobacco dependency service being launched within the hospital. Because I know we get quite a lot of feedback about the sight of people outside the hospital doors smoking when they've clearly got significant health issues. So this service targets people. So when people are in with us, obviously we don't allow smoking within the hospital grounds, theoretically. And so we're targeting, and we will be obviously getting to some of those groups that you have very much described within your presentation. So yeah, just thought I would kind of raise it because obviously it links very clearly to what you've just talked about. Do you want to come in?
Thank you for that. I just wanted to let you know that I'm in constant communication with Kate Frost from the Trust around the rollout of that, the programme of particularly inpatients being asked to abstain from smoking as part of the national long-term plan rollout. So we are really linked into kind of making sure that the patients and visitors coming into the Trust sites are really aware of the campaign itself that the Trust are supporting, but also about trying to encourage ways in which they can actually access the support at the time that they need to beyond their stay within the Trust. So we're trying to make sure that we join up both within the Trust but also when they actually come out and back into the community, that those services are readily available to them.
Councillor Mark Thompson.
Thank you, Chair. It was just a question around the vapes and vape shops. So, I started smoking when I was 11 and stunted my growth, obviously. And one of the things that was made easy to get into smoking was that the local newsagents used to split packets, so you could buy one cigarette and one match. And I've got a funny feeling, and you might be able to back this up or tell me otherwise, that they're walking into school with a can of Monster and a vape in the morning, and that's not just one or two, that is many. And I just wondered if you thought that vapes work at the other end of the spectrum as far as young people getting into smoking. Thank you, Chair.
So I think the evidence is it's still obviously quite early days, but I think as it sort of initially the evidence was that that vaping doesn't necessarily lead to smoking. However, I think kind of anecdotally from what we're seeing sort of locally and possibly as the increase in sort of data is developing, that might not be the case. I think it's probably we you know, and I think also the people who do vape are potentially the people who would, you know, like you say, either go on to smoke or sort of smoke anyway. I mean, certainly the vaping thing is quite complicated in terms of obviously we're sort of advocating it within adult stop smoking services, but equally very kind of not advocating it for young people who don't smoke or anyone who doesn't smoke to start vaping. So we are sort of in discussions with schools, and like I sort of mentioned, we're doing some engagement work in terms of trying to understand the sort of the attitudes to sort of vaping at the minute and how we can do something about that really. But I think it's obviously it's flavour of the month. It's very fashionable, isn't it? Like kids, that is what they do. Like, and it is high. You know, we are sort of seeing high numbers. Is there anything from that you want to sort of?
Yeah, just to say that central government are looking at the whole narrative around the availability of vapes in the first place through the various retailers beyond vaping shops. I think there's been certainly a surge of availability of vapes in lots of different types of settings and retail outlets, and that is of concern and has been brought to the attention of certainly central government looking at that, the regulation of that, but also the penetration of vaping devices coming into the market that actually sit alongside the vaping products that are designed for adults that are licensed and regulated in comparison to the ones that are coming into the system that are classed as illegal and illicit. That's part of that market that's actually targeting children and young people. In terms of the retailers that are legitimate and are there to support adults who wish to quit using a vaping device, that they have their place, and that is highly regulated. But we are seeing that influx of increased vaping amongst children and young people on the back of the fact that, as you've described there, around the availability of it being in that illicit market, and we are monitoring that locally through our West Yorkshire training services, through the work that we do with them, but also looking at this very closely in terms of the national picture, in terms of how that plays out around regulation that is likely to come on board, but for us it's not fast enough. as Becky said, the evidence at the moment is showing that it's not a gateway into smoking, but it's around the whole narrative around children engaging in risky behaviours, and is that part of the issues around the both the physiological but the psychological impacts of products coming into the market that are highly targeting children, as you've just recognised around some of the food and drink industry in which they operate. So we are recognising that. There's some things that we can control in as a local place, but there's things that sit outside of our gift of controlling that, and sits within a much wider piece of work, like I said, that the central government are looking at.
Issue around smoking outdoors, and quite a lot of years ago I was in the park in Dewsbury, and around the play area there was a sign on the fencing saying smoke-free area. It is the only park, I haven't inspected them all in Kirklees, but it is the only park I'm aware of in Kirklees that there's that sort of signage, because you do see people taking their little ones into the fenced-off play area and sitting on a bench and smoking. And whenever it's put in front of children and young people, I think that's detrimental. And I just wonder whether as an authority we could review and look at limiting or trying to limit that sort of activity in our, areas where children are.
Yeah, yes, absolutely. I think it's something that we've looked at previously, and I think for whatever reason maybe it kind of didn't happen, or sort of maybe the appetite wasn't there, but I think it's definitely something that we would be happy to look at. I think in terms of that smoke-free Kirklees, that is obviously one part of that plan that we would really welcome any kind of collaboration on.
Okay, thank you. Alistair, sorry to cut you off.
Thank you, Chair. Thank you. And thank you for the presentation as well. I think on the ongoing vaping debate, which is the big issue just now, I suppose my concern is just that one about role modelling. If the adult in the household is vaping, and especially if they've been given a vape by public health and by the council, what impact does that have on the young person? And I can appreciate that as an anti-smoking strategy, it might be well tried and tested, but I do agree with Councillor Thompson. Vaping is the huge issue for young people. It goes back to a climate issue because they chuck them all over the place, and okay, maybe it doesn't lead to smoking, but it might do. I don't think the evidence is really strong in it, and the toxicity and so on, and unknown conditions there. Every week I think we're seeing a story about vaping, and I really would wish that Kirklees were a bit stronger on it, and just saying no to vaping really is part of that approach, because I think the impact on young people's lives again is really a horrendous one that we don't know about into the future.
You don't necessarily have to answer that, but you can take on board what he's saying.
Yeah. If I can come in
briefly,
yeah,
by all means.
I know we've taken up a lot of your time. The thing about so if we remove some the way in which vaping's been introduced into the market probably needed a bit of thinking through in terms of the things around regulation, but also things around the advertising and packaging of those things. But we are where we are now. And what I would say is that in places like Australia, where they've now taken a position to ban vaping products, and it's only through a prescription, they start to see increases in smoking rates. So we're at the stage where if we were to take away, if we were to think about removing vaping devices altogether, there is also that narrative around would children then take up smoking, and in terms of the current evidence around both vaping and smoking tobacco is that vaping is still presenting itself to be a safer option in comparison to smoking cigarettes. So there's that narrative, and it just depends on which side of the camp you sit on. And I suppose that you're absolutely right in terms of, we talk about smoking behaviour and that learned behaviour in among adults, and then how that then actually translates into children's behaviour. And there's something about the work that we need to do in Kirklees about being really clear about our position in terms of where vaping has its place for sporting adult smokers, the considerations that they need to make as adult smokers opting for vaping devices, and that the way in which they present themselves in terms of children and young people, and what you talked about, Councillor Kendrick, about that visibility of smoking and vaping, and thinking of that through in terms of the spaces that we live and spend time, is as a Kirklees place, how we want to manage those conversations with adults who want to quit smoking, but also about how that then impacts on children and young people. So I think it's an ongoing conversation that we need to keep having.
Thank you very much. Thank you both for coming and spending a long time waiting to have your bit, but it's been really useful. Can I say to colleagues, thank you to all of you who stayed the course. Well done. That is the end of the meeting. Thank you all for your contributions.